out of an abundance of caution. What did you do, Joe?
Sorry.
No, it's all good. Hi. Welcome, everyone. Welcome, Vice Mayor and council members. I call this special meeting of the Albany City Council for May 20th, 2024 to order. Let's see. It doesn't list roll call here, but we usually do roll call. City Clerk, can we have roll call?
Councilmember Hanson Romero.
Here.
Councilmember Jordan.
Here.
Councilmember Tiedemann.
Here.
Vice Mayor Lopez.
Here.
And Mayor Mickey.
Here. We'll move on to item 2. We have a closed session conference with legal counsel, anticipated litigation, and we will break for closed sessions.
There's no public comment.
Sorry. I even have it written right there, public comment. Is there any public comment on this item?
No.
Right. Not seeing anyone in the council chambers either. We'll break for closed session. Welcome, everyone, Vice Mayor and council members. I call this regular meeting of the Albany City Council for May 20th, 2024 to order. And I'll read the land acknowledgement statement. The City of Albany recognizes that we occupy the land originally protected by the Confederated Villages of Lishan. We acknowledge the genocide that took place on these lands and must make strides to repay the moral debt that is owed to this indigenous people, specifically the Ohlone tribe. We thank them for their contributions, which have transformed our community and will continue to bring forth growth and unity. The City of Albany commits to sustaining ongoing relationships with the tribe and together build a better future for all that now make this their home. City Clerk, will you please call roll?
Councilmember Hanser Romero.
Here.
Councilmember Jordan.
Here.
Councilmember Tiedemann.
Here.
Vice Mayor Lopez.
Here.
And Mayor Mickey.
Here. And we have a report on actions taken in closed sessions.
Thank you, Mayor. There's no reportable action.
Thank you. Item number 4, ceremonial matters. Let's see, we have one proclamation today, which I will be reading. In recognition of Mary D. Leah's retirement from the Albany YMCA, whereas Mary D. Leah began her career at the Albany YMCA, Albany Y, in 1987 as the preschool dance and kindergarten instructor. Whereas Mary taught adult fitness classes and became the Y Fitness Director in 1996, overseeing all the adult programs. Whereas Mary was instrumental in planning of the Albany Y's first fitness center in 1998 and the planning and expansion of it in 2014 and 2016. And whereas Mary started the Brown Bag Speakers Forum at the Albany Y, and later collaborated with the Albany Library to open the forum to the entire Albany community. And whereas Mary became the executive director of the Albany Y in 2017, and whereas Mary increased membership from 2,000 in 2017 to 3,000 in 2020, and whereas the Albany Y received Best of Albany Fitness recognition under her leadership. And whereas Mary spearheaded the annual community giving campaign that raised well over $1 million, providing financial assistance for kids, teens, families, and seniors to be able to participate in the Albany Y programs. And whereas Mary's creativity, ingenuity, and persistence kept the Albany Y accessible during the pandemic years by implementing online classes and reorganizing the facility to provide safe workout spaces. Whereas Mary has demonstrated a strong commitment to the Albany community, organizing Red Cross blood mobile donations, food drives, book drives, and through her service with the Albany Rotary. And whereas for 37 years, Mary has demonstrated outstanding leadership and vision to the Albany Y and community, improving and maintaining the health and wellness of thousands of members. Now therefore it be proclaimed that the Albany City Council thanks Mary D. Leah for her many years of service to our community and wishes her well in her retirement.
Thank you so much. I just want to say I really appreciate this recognition. It's really quite humbling, to be honest. And thank you to the members of the City Council of Albany and to the city staff. I've always felt really lucky to have worked in an organization like the Albany YMCA to serve this community. And you may not know this, but the Albany Y has been in Albany for 102 years. And as you just heard, I've been there for 37 of them. So without further ado, anyway, thank you so much. I really appreciate the recognition.
I'm looking to see if there are any council members that want to say anything.
I just want to say thank you, Mary, and for all your work at the Y, and the Y as part of our community. It's really an important connection in so many ways, and thank you for your service.
Yeah, I wanted to also thank you, Mary. My family had many parties at the Y, either our kids or other kids invited us there, and just for the wonderful services that the Y has provided our community, particularly through COVID. So thank you so much. Let's see. Are there any members of the public that wanted to add anything on the proclamation? Not seeing any in the room, any online? Okay, perfect. Well, thank you so much. Let's see, moving on to item 5, City Manager's Report. City Manager, may the council have your report, please?
Thank you, Mayor. I'd like to first address the city's racial equity survey that has been underway for a few weeks to month. We have been working with the consultants based on some concerns expressed by community members, which we take incredibly seriously and want to make sure the survey is representative to all of our community. At this time, we have taken the initiative to put the survey on hold as we continue to work with the consultants to make sure we address the concerns we've heard. And I will provide updates as we move along to find a resolution to the issues raised. I wanted to thank those that have sent in comments. I very much appreciate the feedback as it helps us shape our services for all members of our community. We are doing a new endeavor with our CERT training in partnership with UC Village. This is a great opportunity to expand our network of all residents within our community, and appreciation to our fire department for taking this initiative, along with staff from the village for inquiring about this service. Really just prepares all of us for disaster preparedness as a whole community. Also, the Albany Fire Department is doing a high-rise training event in Berkeley, taught by subject matter expert chief from Denver Fire Department. This is an opportunity for our team to get additional training in areas that will definitely come in over the years as we move forward. We have a household hazardous waste drop-off event scheduled for June 2nd at the Golden Gate Fields parking lot. This is a appointment only, so please subscribe online at stopwaste.org to take part in this event. As a reminder, this month is Older Americans Month. Our senior center has done a fantastic job in scheduling events throughout the month. Recently, we had an event which was Brushes and Brews. And we look forward to an ice cream social upcoming on May 23rd at 1 p.m. and also a movie showing on May 28th at 1:30 p.m. We have an American Red Cross blood drive forthcoming on June 4th from 9:30 to 3:30. As we've heard recently from presentations from American Red Cross, they are very much in need of donations, so please take an advantage of providing back through this opportunity. Summer is around the corner for those with school children, and we are thrilled to provide a jam-packed summer camps program for our student community. Please take a look at all the opportunities within our registration process, and hopefully we have something for your children to do this summer. We are thrilled again with special appreciation to Councilmember Hanson Romero for the connection and the opportunity to present Boheme Out of the Box. This is San Francisco Opera coming to Albany with a free outdoor mobile stage performance. Mark your calendars, Tuesday, June 27th at 1 p.m. This will be on Solano at Avalon Avenue for an afternoon of Boheme Out of the Box. Chairs will be provided on a first-come, first-served basis. Prior to the show, a family workshop will be presented at 12:15. Down the street, we have pickleball very soon to fruition. This is great news. It's a long time coming. I know I've said it before, but appreciation to the pickleball community for their patience as we've moved through this work. This is thanks to Proposition 68 grant program funding, as well as our very own Measure M parcel tax for open space. And we look forward to welcoming this new installation at the park for recreation users, hopefully by the end of May, and certainly through June, with a celebration with the council and community to welcome these new courts. A pavement maintenance project update. The 2023 pavement maintenance and repair project is substantially complete and hopefully being enjoyed by all. We are working on the final striping and other stenciling of the streets, and also some red curb and paint consistent with new state legislation. You'll find these at intersections primarily to help protect all users of the streets and sidewalks. The city's Public Works Department, as approved by the council, has now purchased the electric tools. These were a welcome addition to the crew. And the pictures kind of speak for themselves, so I wanted to make sure to show those. And reports are that they're working very well so far, so that is really encouraging, and I appreciate the department for taking that greening initiative. And that finally completes my report. Thank you.
Thank you, City Manager. I'll turn to council and see if there are any questions. Not seeing any council questions, I'll open it up for public comments. If anyone attending would like to ask a question about or comment on the City Manager's report, please raise your hands here in the audience or online. If you're calling in, you can press *9 to raise your hands. Note, this is for questions and comments on the City Manager's report only. If you have comments on matters not on the agenda at the time for those is next.
Yeah, this is Nick Peterson, actually with Albany CERT. A couple things I want to congratulate the city manager on. Great job working with, and I'm glad that the UC Village people reached out to establish CERT communication with the city and the fire department. There also is a great need for other citizens around the neighborhoods of Albany to step forward and become building block captains. So if you're out there listening and wondering about, please contact the city about CERT, or you can contact Albany CERT Inc. That's the nonprofit organization that helps support the city in their CERT training and everything. The other thing is I just really want to applaud and congratulate the Public Works Department in embracing the electric-powered tools. This is huge, and it really is something we should be proud about, and thank you, Public Works.
Thank you for your comments.
This is Lucinda Young. Just briefly, I also want to echo big thanks to the Public Works for the purchase of electric equipment that's consistent with our climate action and adaptation plan and the recently enacted climate emergency declaration. And I would just like to see that go a little further in that the city only hire contractors that are also committed to the use of electric landscaping equipment. Thank you.
Thank you for your comments.
Hi, this is Catherine Beers with ACAC. Also want to thank the council for adopting the Climate Action Emergency Declaration as well, hoping to see this reflected in more city policies and priorities. Want to agree with the previous speakers and just also share, in case it's already been shared before, that Anaheim, City in California, uses Tesla Model Y electric vehicle patrol cars on 12-hour police shifts. They can carry one arrestee, and the fact that Anaheim's using electric vehicles should be worth, reminding other city departments like police, fire, et cetera, as well as parking enforcement, that electric vehicles are a viable alternative to gas-powered vehicles and worth piloting and testing out for Albany as well. So I want to thank you again for your service.
Thank you for your comments. Thank you, everyone, for providing comments. Let's see. There were no real questions, so I think we'll thank everyone for their comments tonight.
Mayor, I actually do have one point of clarification. I've confirmed with our Public Works Director that indeed the contracts that the city has executed for our landscaping services do employ electric equipment.
Perfect. Thank you so much for that clarification. Moving on to item 6, good of the city. On good of the city, this is for attendees to provide council comments, information, and questions on an item that is not on the agenda. Please raise your hand now in the room or by phone, press *9. If you're on Zoom, if you could use the raise hand as well. Looks like we have 3 comments inside the room. How many online?
I actually have 5 inside the room.
5 in the room, okay.
Yeah,
And how
and
many
online I have 4.
let's see, due to the number of people who are commenting tonight, I think I would like to limit the speaking time to 2 minutes.
Okay. Dr. Alpert, David G., and Tao, please line up at the public comment.
3 minutes, please, compared to 3-minute statement. So we don't see time.
Good evening. Council members know that I am Dr. Stephen Alpert. Why? Because this is the 4th time I am requesting that the city provide the rationale for why it follows only the minimum state mandate of 300 feet notification, regardless of project size, when in fact city alerts are permissible. Whereas the city follows its approved ordinance of only alerting those within 300 feet of new construction, this practice is inappropriate for large multi-story projects which will impact all of Albany. Such is the case for the 5-story mixed commercial residential structure proposed for 1600 Solano at about 400 feet from my residence. I first presented this issue at the council meeting on April 1st. The video of that meeting will confirm that the issue of 300 feet notification was not addressed. Likewise, the video shows that the city attorney declined to comment on the feasibility of a 2-tier notification scheme to distinguish between large and small projects. However, during that meeting, Councilman Jordan stated that existing state laws would create legal exposure if the city adopted different rules for public notification based on project size. Pursuant to my formal document request, City Clerk Hsu responded that no state laws support your assertion. Councilman Jordan is the 2nd city official to invent and cite non-existent state law to avoid addressing the issue of 300 feet notification. The first was Community Development Director Bond, who falsely asserted that state law precluded Albany from issuing citywide alerts for new construction. I'm accusing 2 city officials of fabricating non-existent state law. The veracity of these serious allegations is thoroughly documented in the public record, and neither Director Bond nor Councilman Jordan have contested them. During a recent chance encounter, Councilman Tiedemann related that he did not concur that false assertions were made by either city official. I protest. I was expecting 3 minutes. I would like to finish. Ms. Liu, may I finish?
Please wrap up your comments.
Thank you. During a recent chance encounter, Councilman Tiedemann related that he does not concur that false assertions were made by either city official. In response, I will revisit these allegations. Regarding Director Bond, at this Wednesday's meeting of the Planning and Zoning Commission, I will again present firm evidence that no state laws prevent a municipality from issuing a citywide alert for new construction. During our encounter, Councilman Tiedemann suggested that the document search conducted by Ann Sue, City Clerk Sue, may not have been sufficient to uncover the precise legal issues which Councilman Jordan referenced during his April 1st meeting. Let's assume that this is accurate. Thus, would Councilman Jordan please provide the exact text and location of the state laws which he stated would create legal exposure if the city adopted a 2-tier notification system for new construction based on project size? Mentioned at the start of every meeting, the Brown Act prohibits lengthy discussion of topics not on the meeting agenda. Accordingly, I am again requesting that the issue of 300 feet notification for new construction be submitted as a formal agenda item so as to allow for extended, in-depth public discussion. During our encounter, once again, Councilman Tiedemann stated that no council members are considering the 300-foot notification as a new agenda item. Council members, is this accurate? Thank you for allowing me to address the council.
Thank you for your comments.
Hello, my name is David, and I'm an Albany resident. I've lived here since 1992. My kids have all gone to the Albany schools, and I'm here to bring up the racial equality survey that recently went out and has since been temporarily halted. I'm a small business owner, and I know the importance of checking the companies I buy products and services from. I would expect that our council members would even be more cautious when it comes to spending money that belongs to the taxpayers of the city. I'm bothered by the fact that our city is spending taxpayer dollars on a survey that is not concerned about yielding accurate results. Under the demographic section, it asks the person taking the survey to check off their ethnicity and lists many countries of origin, such as under the Middle East section, they listed Egypt, Iraq, Jordan, Lebanon, Saudi Arabia, the UAE, and Palestine. Okay, as I'm sure you're all aware, Palestine is not an internationally recognized country. Israel is an internationally recognized country and is not on the survey. After doing some research on the organization you've collaborated with, the Justice Collective, I was quick to notice how one-sided they are towards the Palestinians. Despite the Justice Collective claiming to work toward equity, the stories they post on their social media nearly daily are blatantly anti-Israel. I have a hard time understanding why our city is spending over $100,000 on a survey that's more than likely not going to provide accurate information. It's just like a waste of money, guys. And I was always taught you spend other people's money better more cautiously than you spend your own. Since this organization is obviously biased, I'd like one of you to contact me after this meeting and explain to me why you'd be willing to spend our money on a survey that's not going to accurately reflect our community and is clearly not inclusive of all marginalized groups of people. Thank you.
Thank you for your comments.
Okay. Hi, my name is Tal, and I'm an Albany resident. I didn't expect the racial equity survey would be mentioned during the manager report, but I did prepare myself to speak, so here I am. According to the Albany City Council staff report, the survey is one of the next steps in the Racial Equity Impact Plan. The recommended actions based on its results would continue progress towards fulfilling objective of goal number 4, which is encourage community connectivity through diversity, equity, and inclusivity. With this in mind, I'd like to know, if the end goal is to be a diverse, inclusive city, why do Jewish people not have a spot to identify with under the demographics portion of the survey? Many Jewish people do not fall under white and should not be forced to identify as other. On page 11, under the proposed project timeline is written, collaborate with the City of Albany's project leads to refine assessment and communication strategy. This step is right before survey rollout. So what was the collaboration like that Jews were so easily excluded? I'd like to note that I almost went directly to the consulting group about this issue, but after checking their social media pages, I saw the consultant not only celebrated and justified Hamas's October 7th attack in Israel, but also put quotes around the word Israel and called it "is not real," a clear refusal to acknowledge Israel as a country. It was then obvious that this was not just a simple oversight and that the organization will not recognize Israel as a home for Jewish people. While I wish to see a space included for Jewish people in the equity survey, my last question is, how is the City of Albany going to ensure the results be as accurate as possible? It's no secret that the consulting group is unsupportive of Israel as a state and thus devalues the lives of many Jewish people. How are you going to know that the data they give you is even correct? Thank you for your time.
Thank you for your comments.
Julie Baller.
Apologies, we do not, we ask that all participants not clap or boo or show any form of affirmation or support or dissent. Thank you.
Julie Baller and Howard Graves.
It's Ballard. Thank you. Thank you for the opportunity to speak. It's all new faces since I last was here a few years ago. My name is Julie Ballard. I live at 913 Ordway Street, and I have lived in Albany since 1982 or 1983. And I have a concern. I want to address myself to the question of notification of people in the neighborhood about projected building that's going on. We live near the corner at 1600 Solano Avenue. That's 3 doors from our house. So we were notified and have been aware of the series of projects that have been proposed for that site, and have helped clean it up from time to time because it is kind of messy since it's been in limbo for quite a while. I do think it's really important that a project of this size, which is unprecedented for certainly for that part of Solano Avenue, that people have the opportunity to think about it, hear about what its purposes are and how it fits in with the state laws mandated and the opinions of the city council, and that people be heard. And you won't hear from people if they don't know it's happening. I think 300 feet is really too small, and I want to second that part of Mr. Alpert's statement that I think that it should be a citywide notification. And actually, a couple of years ago when there was an activity around this, I was one of the people who spent time going from door to door with an informational sheet that had that you probably, those of you who were on the council at that time may remember, had the pictures of the diagrams that you had at the city of what was going to be built and how big things were. And I distributed those myself by knocking on doors, which is time consuming, and spoke also in particular to merchants up and down Solano who were very concerned about the effect on their parking. So I just want to say, I do agree that there should be wider notification. Thank you for the chance to talk to you.
Thank you for your comments.
Good evening. Thank you for the opportunity to speak. My name is Howard Graves. I live at 913 Ordway Street. I want to support in general, the comments of Dr. Alpert's and of my wife, Julie Baller, about the 300-foot notification. We brought this issue up 2 years ago when this project was approved. At the time, because of our wider notification of the city council had the largest attendance by Zoom because it was COVID. Because of this issue, the council and the planning and zoning made a decision which has been very unpopular, but they said was in accordance with state law. But we would argue that the council should direct planning and zoning to develop appropriate guidelines for mega projects that would dramatically change the character of the community, especially for streets like Solano and San Pablo. 300-foot limit is not appropriate, and in fact, by having such a small limit, it is a form of public information suppression, similar to voter suppression, because most of the community wouldn't be aware of projects which could dramatically affect the community. Secondly, I would encourage the city council to take up the idea of a vacancy tax. In this time of housing problems, the city of San Francisco passed and is implementing a vacancy tax of units that have been vacant more than 6 months, and that building at 1600 Solano has been vacant for 2 years. Thank you.
Thank you for your comments.
Go ahead, Amy Smalley.
Hi. Hello, Mayor, members of City Council, staff. It's wonderful and extremely important that Albany residents and business owners can attend meetings of commissions, committees, and City Council in person or on Zoom to be informed and give written and verbal input about all the items affecting our city and our lives and your lives. The agenda and the corresponding attachments, plans, staff reports, historical information, data, charts, public comment are a crucial part of being able to be informed and ask pertinent questions and provide proper input. Since at least April, there's been a glitch on the website when you click on the eyeball icon, which people are very familiar with, which you should be able to open any attachment to any agenda item, you get an error message. It's possible to download attachments, but people may not know that that option's available, or they may not want to download a bunch of big documents onto their phone or their tablet or computer. Or they may just get an error message and then get frustrated and give up and not try to find various workarounds. I contacted staff in April and they indicated they're working with your vendor on fixing this, but more than a month later, it's still not working properly. If you want people to truly be informed and involved, they have to be able to easily read the supporting information regarding your agenda items in order to give that informed input. So I hope this will be resolved soon. Thank you.
Thank you for your comments.
Yeah, good evening. Nick Peterson with Albany Climate Action Coalition. So great accolades for Public Works using the electric-powered maintenance tools. That is fantastic. Let's push that a little further. Let's bring back that gas-powered parking monitor cart and let's make it electric. That is an easy do with the City Council having just passed the climate emergency declaration. It certainly would make sense to have at least one city vehicle that's out on the street all the time be electric. So I encourage you to really pursue that. You know, I was just doing some research on, I think there was a concern about battery fires. Gasoline vehicles are much more likely to burst into flame than an electric vehicle. I think out of 611,000 EVs in the US during 2023, there was something like 30 fires, maybe even less. Whereas with gas-powered cars, 4-point-some million, there were almost 4,000 fires. So it really is not that people bring up the fire thing and it's really a bogus issue. So thank you very much.
Thank you for your comments.
Henry, go ahead.
Thank you so much. Good evening, council members. My name is Henry Simons, a Principal Government and Community Relations Representative for BART. I'm just calling to make a brief comment about a big project coming up that I just sent you an email about. BART will begin replacing 16 interlockings between MacArthur and 19th Street stations the weekend of June 22nd to 23rd. Interlockings allow trains to move from line to line and are essential to the safety of the BART system. Each interlocking replacement will require substituting train service with bus service between Rockridge, MacArthur, and 19th Street stations 1 weekend a month, most months through June 2026. Riders can expect delays up to 40 minutes between those stations and less frequent service system-wide on work weekends. In 2024, work will occur on June 22nd to 23rd, July 20th to 21st, August 17th to 18th, September 21st to 22nd, October 19th to 20th, and November 2nd and 3rd. This is the largest project to be rebuild BART, funded by Measure RR, the bond voters passed in 2016. And we know that this will be a very disruptive project, so we would like to thank our riders in the Bay Area for their flexibility. For more information and a list of the weekend shutdowns, council members can refer to the email that I sent earlier this evening, and members of the public can go to bart.gov/news. Thank you so much.
Thank you for that update.
Yes, this is Lucinda Young. I first want to express my strong support for more affordable housing in our community and applaud any and all efforts that our city council makes in that direction. We have a severe housing shortage. Second, I want to echo the earlier speaker, Nick Peterson, asking or urging the city council to reconsider the purchase of another gas parking enforcement vehicle. That's inconsistent with our climate action and adaptation plan. as well as the recently enacted climate emergency declaration. That declaration specifically requires that the city prioritize climate concerns. And the declaration states that the city will set policy and assign resources through the lens of climate action, coordinating across departments and functions to ensure an effective and timely transition off of fossil fuels. The Climate Action Committee has done extensive work on electrifying our police force, not just police force, but our city vehicles. And the parking enforcement vehicle would be a prime thing to start with. At the Climate Action Committee meeting last week, it was reported that the police had recommended against electric because of concern about fires. That is not, there's no authority for that. It's basically a propaganda by the fossil fuel industry to continue our addiction to fossil fuels. And I would strongly urge you to reconsider that. Our city staff, who are not climate experts, should not be setting climate policy for our city. Thank you.
Thank you for your comments.
Hi, my name is Cecilia Avila. Sorry, I think there's another name listed on the screen, but my name is Cecilia Avalar and I'm an Albany resident. And I just want to affirm the city's efforts to reach out to the community and work towards racial equity. Specifically, I really want to applaud the city for including Palestine as one of the survey options. Just for reference, Albany does have Palestinian residents. And so for me, as a non-Palestinian, it's extremely important to me that the full diversity of our community is represented. And this is just a reminder and perhaps context for our city council members and city manager and whoever may be in charge of the survey or has a say in the survey. Some context is, again, that race does not equal ethnicity. So there can be people of the same ethnicity and different races. For example, just as there are white Latinos, Afro-Latinos, and mixed race Latinos, there can also be a diverse range of races within an ethnicity, including white. So again, people can select white and also another ethnicity. That's totally possible. And it's important that if we are responding to these surveys as community members, that we educate ourselves on the definitions of these terms, but perhaps that could be a future education initiative for the city of Albany so people are informed about their options when they're responding to things, because it is important that we are accurate about our responses. And so again, really want to make sure that that option for including Palestine stays in the survey when the new survey comes out. And I want to applaud the city's efforts in including all of our residents, including our Palestinian residents in the survey. So thank you.
Thank you for your comments.
Hi, this is Catherine Beers with ACAC again. Want to agree with previous speakers, Nick Peterson, Lucinda Young, on getting more electric vehicles in Albany as a part of advancing climate action plan, as well as the emergency declaration and integrating that in the city. I want to also reiterate the importance of additional housing. The Bay Area has a housing crisis, as does Albany, and more housing, higher buildings on commercial streets, multi-use housing, mixed-use housing. We need more housing on all of it. So I want to support any efforts towards that. Also wanted to talk to the green business folks today at the Alameda Green Business organization, where they're helping businesses get certified in that area, and they are interested in supporting the reusable foodware ordinance. If you want to help get more support on talking to restaurants or helping advance reusable foodware in Albany, that would be great. I know we have a previous presentation from the CAC that there's 60 tons of plastic foodware that gets thrown out in our waste stream in 2021. So it's a lot of plastic in our trash that we can prevent through better education, both of restaurants and patrons, people bring their own containers and also do different reusable options like Deliver Zero. So thank you for your support.
Thank you for your comments.
That's it.
I want to thank everyone who provided comments today. Let's see, I'm looking to the city or the city attorney for any responses.
Mayor, I do have response to one question raised, or concern raised, that we share regarding the access to the agenda items We have escalated that issue with our service provider, and I expect to have information update this week. And we will continue to request and require that that be resolved, and I appreciate the patience. We are sharing it with you. Our city clerk also has a demonstration in terms of how to access the content in the meantime.
So if you click on the item, the subject of the item, usually at the end of the item, the drop-down will show up with all the attachment. You can click it again and it will retract. And you can click the icon here and it will allow you to view without downloading. And you can download as well, but the icon works here.
And again, this is a short-term solution, workaround. We are working to resolve the issue overall.
Mayor, if I might have a moment to just address some of the questions that have come up or issues that have been raised regarding notice of our various projects, specifically housing projects. The law requires for such discretionary permits that under Government Code Section 65905, we're required to hold a public hearing and provide notice to property owners that are within 300 feet of the subject property. And the city complies with that requirement. That is a standard requirement that cities utilize, a 300 feet notice. In addition, anyone can ask that they receive specific notice from the city clerk. That's under 65092, and then the city clerk can mail notice of those public hearings to the individual. The city can charge a fee for that. So anyone who wants to receive notice of any such projects, whether they're 300 feet from their property or not, can receive that notice. Furthermore, under the Brown Act, anyone can ask for the notices of the Planning Commission meetings, the council meetings, so they can review the agendas as items are coming up and see what's going to be on the agenda. To increase the 300-foot radius, which has been suggested beyond what is required by law, will have time and financial impacts. The cost of such to provide the notice will either need to be borne by the city, but most likely will be passed to the applicant. And this could be seen as an impediment to housing. Under housing element law, specifically Government Code Section 65583C3, it provides that cities should address and, where possible, remove governmental constraints to the development of housing. In fact, the California Department of Housing and Community Development, we call it HCD, in their housing element guidebook specifically discusses permit fees and processing and references strategies to reduce or waive fees for housing projects and expedite processing of those applications. So to do that, in our housing element, we adopted policy 4.5, which says, ensure that Albany's planning processes and fees are reasonable, do not create an undue burden on residential development. In addition, we did program 4.5, which was to continue to provide reduced fees and expedited processing procedures for affordable housing, and review the impact of these incentives every 4 years and revise them as necessary. Therefore, the city will continue to comply with state law with a 300-foot requirement for the radius, and anyone who would like additional noticing should contact the city clerk and could be put on a list to receive noticing. Thank you.
Thank you for that clarification. With that, we'll move on to item 7, consent calendar. Items on the consent calendar are considered to be routine by the City Council and will be enacted by one motion. By approval of the consent calendar, the staff recommendations will be adopted unless otherwise modified by the City Council. There will be no separate discussion on items unless a council member or a member of the audience requests removal of the items from the consent calendar. Before we go into the consent items, just for the members of the public, item 7.9, the memorandum of understanding between the City of Albany and the Albany Firefighters Association has been pulled from tonight's calendar. You are welcome to comment on it, but it has been pulled and will to be brought back at a later date. Looking at the council, are there any items that you would like to pull? Not seeing any items for the City Council, I will ask if there are any items from the public that they would like to pull?
I have a speaker card for 7-8. Eric?
Were there any online comments?
No.
Hello, my name is Eric Larson. I'm a member of the Climate Action Committee, and I wrote the recommendations for the city fleet electrification and charging stations. And so I'm very excited that the Climate Action Committee has passed those along to City Council, and I'm very excited to see those get enacted. It's a great step in terms of working on our climate action plan. It's an item in the climate action plan, and I'm really excited about getting those implemented. So I really appreciate your support on that. I just wanted to come and, say thank you for bringing it to the fruition here. And if you have any questions, I'm available, but it's hopefully pretty straightforward. And looking forward to, getting the city fleet electrified so we can really make a statement for City of Albany is behind electric vehicles and electrification and the climate action plan. So.
Thank you. Any comments from council members? I wanted to thank you for bringing this forward. I'm really excited about this, both what studies can be done for what is done on city-owned property, but also for public charging stations, particularly given our efforts on street lights for the city and understanding where there might be a nexus to be able to install new street lights as we run the electrical power, also potentially install EV charging stations in the public right away. So thanks so much.
Great. All right. Thanks very much.
Mayor, I have one more comment online.
For this item?
Yes.
Perfect.
Yeah, Nick Peterson with the Climate Action Coalition. This is really great that this, it's taken a long time for the Climate Action Committee to bring this forward to City Council. And I really thank, especially Eric Larson, for his hard work on this. He's really been a stalwart person, keeping it going, sometimes being the only person on the subcommittee to keep it alive. And I think it's really critical. We did get a report. There was a report at the Climate Action Committee about city vehicle electrification, and it just seemed like everything was off in the distance for a while. And this brings it a little bit more home. And of course, that leads into my next comment, which is what a great opportunity to start out the whole program with showing Albany citizens that the City of Albany is behind electrifying their fleet by having that nice little feeder cart buzzing around, not spewing fossil fuel emissions anymore. So anyway, let's implement it. Let's get it moving. Really appreciate the hard work of Climate Action Committee, and thank you, City Council, for passing it.
Hi, this is Catherine Reese with ACAC. Also want to express my appreciation and support for the electrification and infrastructure for public charging in Albany. It would be great to see Albany take a leadership role in this area, and I'm excited to see this happen. So thank you for supporting this. That's all.
Thank you, everyone, for providing comments. Looking to.
I'll move the consent calendar.
Thank you.
I'll second. I assume that's less 7-9.
Yes, less 7-9. Thank you.
Vice Mayor Lopez,
Yep.
Mayor Mickey,
Yes.
Councilmember Hanson Romero,
Yes.
Councilmember Jordan,
Yes.
Councilmember Tiedemann.
Yes.
Motion carries.
Thank you, everyone. We'll move on to item 8.1, presentation from the City of Berkeley Mayor Jesse Araguin and Councilmember Sophie Hahn on the impacts of Alta Bates Hospital closure.
Well, good evening, Mayor Mickey and members of the Albany City Council. I'm Berkeley Mayor Jesse Araguin. I'm joined by my colleague, Councilmember Sophie Hahn. We want to thank the City of Albany for this opportunity to talk about an issue of regional significance, the proposed closure of Alta Bates Hospital and how that will impact emergency and healthcare access for not just the cities of Berkeley, Albany, but the broader East Bay community. And joined by Councilmember Hahn, who's been a critical partner in this work. And I want to just acknowledge and thank the City of Albany for your ongoing participation in our work to address the closure of Alta Bates Hospital, starting as far back as 2017, when I convened a regional task force made up of representatives of cities throughout Interstate 80. And I want to acknowledge the work and engagement and support of Mayor Mickey and the work of former Mayor and Councilmember Pagan McQuaid, who's in the audience, and former Councilmember Rochelle Nason, who were also very active partners in this work during their time on the City Council. So we're here today to present some key findings from a report by researchers at UC Berkeley, led by Professor Jason Corburn at the Berkeley Institute of Urban and Regional Development. And this study was conducted in 2018, but we are doing an update to this study and hope to present revised findings to the City of Albany in the coming months. The impetus for the study was Sutter Health's decision to close Alta Bates Hospital by the year 2030. And one of the reasons that drove Sutter Health's decision was the state mandate that acute care hospital facilities need to be seismically retrofitted by the year 2030 to meet state requirements. We maintain that Sutter Health can make the investment to retrofit Alta Bates Hospital to continue to ensure that our region has a full-service acute care hospital and birthing delivery center to serve our constituents. And we are here today to talk about what the impacts of that closure mean, not just for our East Bay communities, but specifically for the City of Albany. And so this assessment was conditioned by the Regional Task Force to understand the potential impacts of closure of Berkeley's Alta Bates Hospital, an acute and emergency care hospital with significant birthing, cancer, surgery, and other care services provided at that site. If we can go to the next slide. Oh, I have the clicker. There we go. I want to provide some context about Alta Bates and sort of the services that are provided there. There are currently 347 beds at Alta Bates Hospital in Berkeley on Ashby Avenue. It's the third largest acute care facility in the region. As of 2016, certainly those numbers have changed since then. 66,268 patient discharges, the second highest non-Kaiser hospitals in Alameda County, 45,000 ER visits. 61% of those ER visits were Medi-Cal or Medicare patients. And obviously, 5,863 live births in 2016. As we know, Alta Bates is known as the birthplace of the East Bay. It's a place where a lot of birthing delivery happens in the East Bay area. The purpose of the revised study will be to update some of these statistics, provide current context, but I think we also know that the pandemic, I think, has really illustrated the importance of having an acute care facility in or nearby our community. And also with the Hayward Fault going through part of Berkeley, with threat of wildfire risk, sea level rise, other natural and man-made disasters, it's critical that we have a full-service hospital to serve our communities. So Alta Bates is a critical hospital, not just for Berkeley, but for the whole I-80 corridor from Highway 24 to the Carquinez Bridge. And because of this, we have approached this issue with a sense of urgency, not just for the city of Berkeley, but for the region as a whole. And so with that, I want to turn over to Councilor Hahn, who's going to provide a little bit more information on the findings of the study. I'll do the slides for you.
Thank you. Well, thank you for having us. Alta Bates is located in Berkeley, but we know that it serves the entire region, and that's why we have chosen to come out and try to talk to all the different communities and raise your awareness of what it's really going to mean, not just for Berkeley, but for the entire region, for the people of Albany and all of the communities, for this hospital to close. So Alta Bates, as the mayor said, is one of the highest volume emergency departments in the East Bay. In 2017, they had over 50,000 emergency department visits. I mean, it's just staggering when you think that in 1 year they have that many visits and they're going to be gone. That was a 21% increase from 2010. In fact, in that same year, the Alta Bates Emergency Department was operating at more than 6,000 visits above the capacity that was recommended by the American College of Emergency Physicians. So we have this ER that's busting out at the seams, and they're going to shut their doors. So at a time when we really need that increased capacity, the closure is going to be, quite frankly, catastrophic. And one of the things we do is we kind of try to pay attention to permits that might be being pulled in Oakland to expand the setter capacity at their emergency rooms there. And we see no such activity. We do not know of any effort to increase the capacity of any of the emergency rooms that people would end up being diverted to. So another thing that people don't always think about is that Berkeley and neighboring jurisdictions have a limited number of ambulances. And closure results in ambulances having to travel farther to transport patients to the next closest hospital, and that reduces the overall response times. But it also means that the ambulances are in service longer. So they drive farther, they wait longer, and they take longer to come back, and maybe they could have done a second run during that time. So it ties up our resources, our city resources, each of our cities. And it really has an impact, not just on health, but on costs that each jurisdiction is going to have to absorb. A 2014 study conducted in California found that patients who lived near a closed emergency department and were later admitted had a 5% higher chance of dying in the hospital than those that did not live near a closure. And the study concluded that emergency department closures do have a significant effect on patient outcomes. So as you can see, a majority of patients at Alta Bates are people of color, and 41% are uninsured or are Medi-Cal recipients. 23% of patients are over the age of 60, and 11% of the population within the hospital service area has a disability. Closure would result in interruption of service to these groups who will have more difficulty accessing healthcare elsewhere. And of course, America is woefully behind other wealthy countries when it comes to maternal care, but Alta Bates has some of the best health outcomes for birthing services compared to regional and state averages. And again, as mentioned earlier, with almost 6,000 babies born every year, as the birthplace of the East Bay, the closure is going to result in higher maternal morbidity, especially for women of color. Berkeley, and we assume Albany as well, has an aging population. In Berkeley, with 20% of the city expected to be age 65 or older by the end of the decade, closure will reduce the number of acute care beds that are needed to meet the Bay Area's increasing number of hospitalized elders, impacting access to critical treatment and emergency care as well. We have seen a rise over the past decade in the number of patients coming in due to a mental health emergency. Nationwide, there was a 44% increase in emergency department visits due to a mental health or substance abuse issue between 2006 and 2014. That's before the pandemic. And in 2016, 4% of emergency department patients at Alta Bates were actually transferred to psychiatric care. We all know that there's been a huge wave of stress and psychological impacts of the isolation and the fear and all the other impacts of the pandemic. Closure of the hospital could result in an increase in suicide attempts, as emergency departments are often the front line for assessing suicide risks. So while closure of Alta Bates will have significant impacts on Berkeley, the ripple effects of the decision that Sutter is making to close the hospital will be felt across the entire region, including Albany, and in other communities that have severely populations who have greater health needs and are more vulnerable. So some of our neighbors to the north. Hospitals also have an impact on the economy. Alta Bates is a major generator of economic activity. They draw in billions of dollars in revenue from medical reimbursements that come overwhelmingly from outside the region, so they're bringing money in. Medicare brings in federal dollars, Medi-Cal brings in a combination of federal and state dollars, and private insurance brings in money from corporations across the country. With this continuous source of revenue, hospitals like Alta Bates typically spend overwhelmingly within the metropolitan area and its surrounding areas. And economists estimate that an average urban hospital spends at least 80% of its patient revenue within the metropolitan area, contracting with local companies for everything from medical supplies and equipment to laundry, parking, security, food, and of course staff and visitors who spend money in the hospitals and around them as well. So Alta Bates also contributes to the regional economy by employing hundreds and hundreds of staff, no doubt, a good number of whom live in Albany. And as a nonprofit hospital, it's required by law to reinvest surplus revenue back into the community in the form of community benefit programs, with some $91 million annually contributed towards quote-unquote charity care or providing free medical services to those without coverage. And so you really start to see the staggering impact of the loss from an economic perspective and a jobs perspective, especially where we don't see that capacity being expanded anywhere in the immediate area. Major disaster events. In the Bay Area, the two most likely disasters we face in this area are earthquakes and wildfires. Access and time to treatment are critical for many of the injured, and considering the majority of impact will be in Alameda and Contra Costa counties, there will be an increased pressure on the existing hospital network and emergency services to respond and treat what is expected to be a huge surge in patients. And of course, the pandemic wasn't even envisioned at the time that this study and report were done, and we saw our hospitals fill up with people with critical and urgent needs. You can only imagine when there's no burn unit, when there's no place to take people who've been crushed by falling beams or debris in an earthquake. It's terrible on an everyday basis, but it's really catastrophic for all of our communities. And we know that one or more of these catastrophes is probably going to happen. So it's critical to note that the Summit campus in Oakland is bound by freeways, including 580, 980, and 880. And under the haywired scenario, there's a high possibility that local freeways will be compromised. And hospitals, including Summit, will not be accessible. So the idea, which Summit has said to us, which Sutter has said, oh, well, it's only a mile away from Alta Bates. Well, when you have to go on the freeway or you have to go through the MacArthur Maze, it's a lot further than a mile. So that is another issue that is going to be critical for all of our communities. We did look a lot at impacts to West Contra Costa County because, as you know, Doctors Medical in San Pablo closed, and Alta Bates absorbed a lot of the patients. We saw a sharp increase in patients from West Contra Costa County. So the closure of Alta Bates is going to have really significant adverse impacts to our neighbors to the north. And while there are many vulnerable communities in their service area, primarily in Oakland and Emeryville, those communities are currently served by the existing Summit campus and Highland Hospital and Kaiser in Oakland. And so these communities in Oakland and in Emeryville are not going to be as severely impacted. And then coming to Albany, Albany residents will increase their travel times to the Summit campus if they can access it, leading to delayed emergency care and more ambulance diversions. And it'll be the vulnerable populations in Albany, elderly folks, low-income residents, and people of color who will be most adversely impacted. And then, of course, the economic impact and the extreme potential impacts in case of an emergency. So that's the data that we have to show you. It's very uplifting, but it's important, and the mayor's going to close out with some additional comments.
Well, thank you. And just on this slide here, it's principally the zip codes that are in red. I think most of that principally is in Albany. So I think it illustrates, it says 40 to 49 minutes. That's a projected increased travel time to the Summit campus. Obviously, the new study is going to provide an update and to see whether, does the same conclusions still hold? They likely will. Okay. As we noted, the closure of Alta Bates will have a devastating impact on communities throughout the northern East Bay along the Interstate 80 corridor, not just including the city of Berkeley, but also the city of Albany as well. And certainly the COVID pandemic has reinforced the inequities across our society, especially within healthcare and healthcare access. So we need to continue to work together as a region to ensure that all of our residents have access to healthcare and the emergency services that they need. To that end, my office, continues to work to convene regional leaders. We have, I think, Richmond, El Cerrito, Albany, Emeryville, Berkeley, Contra Costa, Public Health, Supervisor Joya, Supervisor Carson, City Manager has participated in our meetings, your City Manager, Alameda County Public Health and EMS. So we're trying to bring together the city managers, the mayors, and the public health and EMS departments from not just Contra Costa and Alameda County. We've had, I think, a number of discussions over the past several months around not just the impact of closures, but the need for us to work together as a region. We are currently working with a new team of researchers at UC Berkeley. I want to thank Chancellor Christ, who has dedicated resources to help us do an update to this health impact assessment that we did pre-pandemic in 2018. The team's led by Professor Jonathan Kolstad, the School of Public Health and Haas School of Business, and they're working to provide an update to this study, and we hope to have an updated report as early as August of this year. So we look forward to providing that report and also having an update before Albany City Council in the fall about those findings. And we will continue to coordinate with all cities in the corridor to ensure that the study is well-informed with appropriate stakeholder input, and that we can, based on the conclusions of that study, talk about how we can work together to explore solutions, not just to keep Alta Bates open, but if Sutter Health unfortunately decides to proceed with closure, to explore alternatives to make sure that our communities will continue to be served by a full-service hospital. So with that, I want to thank you very much for this opportunity. We're happy to answer any questions and look forward to continuing to work with you.
Thank you, Mayor Arreguin and Councilmember Hahn. I'll open it up to questions from Council. Councilmember Tiedemann.
So first of all, thank you all for being here. I know you're two of the busiest electeds in the East Bay, so your time is valuable, and it's obvious that this is a big issue that you both care about. You've convinced me that it's going to be really bad with Alta Bates closes. No shock there. What do we do about it? And how can Albany be a part of that and support those efforts of trying to get something to replace this service?
Great question. Happy to provide my initial thoughts, and Councilor Hahn, if you have anything to add. We have been trying since 2016 to persuade, beg Sutter Health to reconsider the decision they made 8 years ago to close Alta Bates in Berkeley, to very little success. And so, I think there is strength in us being organized and speaking with one voice, and not just the local government leaders, but also state leaders as well. But part of what the study that we're conducting will not only look at is not just a lot of the key outputs that we have presented, but also looking at what are the healthcare needs of the broader region and what are some options. And it may be such that We are unsuccessful in pressuring Sutter Health to make the investment to stay, and that we need to look at other alternatives, working with other healthcare providers, looking at creating a healthcare district. We are exploring. We did provide funding through our city budget to hire experts, outside counsel, financial experts, to assist the city of Berkeley in our analysis of various financing options around what it would take to help finance a retrofit of a hospital, what it would take to help build a new hospital. We hope the outcomes of that analysis will help inform not just discussions that we will have at the Berkeley City Council, but also discussions we could have collectively as a region. Councilor Hahn, anything else?
Well, I just wanted to, thank you, Mayor. I just want to reiterate that since we were both elected, when he became mayor in 2016 and I joined the council, the two of us have really, obviously with the mayor's leadership, we have been consistently reaching out to Sutter. I mean, we are pretty much scheduling with them at all times. And it can take 6 months, sometimes a year, to actually get an audience. And we sit down, I just want people to know that we sit down with them and we say, what do you need? We need this hospital stay open. We have things that we can help you with. We can help with land use entitlements, zoning. We can help raise funds. We can, what are the factors that are leading you to close? Is it money? Is it, what is it? We come to them and we say, literally, tell us what you need. And we don't get a response. And so we even haven't really gotten a straight answer to the question of whether they are actually going to close. They have said they're going to. But we've never really had them sort of confirm that. We just have to go on the assumption, as time has gone by, and obviously we lost time with the pandemic, they were busy saving lives. We were not able to continue those conversations. But again, realistically, if you're going to rebuild a hospital and have it open its doors 6 years from now, you'd really have to be pretty far along in your plans. And so we are just deducing, because they have not told us what we can do to help them stay open, and they don't seem to be pulling permits in Berkeley or Oakland, well, they must be closing their doors. And so, this study that we're doing is not just an update of the 2018 study. It is to look more broadly so that we all can understand, you and we, Berkeley, can understand, but also perhaps another operator might understand that there actually is a good reason to service this region with a full-service acute and emergency care hospital. And we're kind of waiting for that study to be in hand before we kind of think about what our next steps might be and then hopefully enlist you. It would be great to have someone in the state Senate who understood this issue. Right now we're working with Senator Skinner and Buffy Wicks, and they're obviously concerned. But we're probably going to have to organize our local jurisdictions around a common vision if we're really going to make this happen.
I'll just also say, we've explored a variety of approaches. Is there an avenue in terms of the State Board of Equalization and their compliance with their community benefit requirements? They're a not-for-profit entity. They have to meet certain statutory requirements. Are they in compliance? We've looked at legal options. There may be a legislative path at the state level. Senator Skinner did have a bill that she had introduced 7-8 years ago that would give our Attorney General more control over hospital closures, because right now, other than just providing notice within a certain time frame before a closure happens, there's no role for any state or local government agency to play when a not-for-profit entity decides to close a hospital. But this is an issue of statewide concern. So, we will continue to explore every possible avenue. But I think one thing is not everyone in our community knows that this is happening. So I think part of what we want to do collectively is raise awareness of this critical issue, and also look at a variety of options. What can we do to work with Sutter to find a solution, and if in the absence of Sutter, find an alternative?
Looking for any other questions from council members.
I have a question, but just want to give a quick comment first. Appreciate both of you coming out here to discuss this urgent matter because, as you just stated, Mayor Arguin, there is a sense of urgency to get this conversation on the priority board. I have been on the receiving end of what happens when you lose access to a medical center. I was living in Richmond when we lost Doctors Medical Center. In fact, I was in the ER, like 2 weeks before it closed. I had suffered a mild heat stroke. And you just sit there and wonder, like, what's going to happen when this place closes? Like, had Doctors Medical Center not been there, there's a pretty significant chance I wouldn't have gotten the necessary and urgent care that I needed. So I appreciate both of you making this a priority issue right now because that's not the same energy we got when Doctors Medical Center closed. And without getting too deep into it, I know a lot of that played into that is race and socioeconomic conditions in that community that I grew up in that I still call home. Alta Bates is somewhere that definitely has a soft spot in my heart. Several of my sisters have given birth to their children there because Doctor Medical no longer exists. And so the question I want to get to is, I also know there's quite a significant number of people in the UC Village where I currently reside who rely on the presence of Alta Bates. And when I say rely, I don't just mean the student, the children, because often the children can't access SHIP benefit, that's the health program at UC Berkeley, because unless you're dirt poor, you have to pay several $1,000s to add your child or any dependent onto your insurance plan at UC Berkeley. So the question I'm getting to is, to the extent possible that you can share publicly, what has UC Berkeley contributed or planned to contribute in terms of these conversations? Because that is a significant population in the city of Albany that does rely on Alta Bates, and once it's gone, and I hate saying that because I'm more or less manifesting it, but once it's gone, what happened to all those the families and the children in the UC Village who don't have privilege of wealth and income to pay for to have a membership with Kaiser or such?
Well, the university has been a very active partner in this effort. They're just as concerned as we are that Alta Bates will close. The university doesn't have a hospital. There used to once be a campus hospital. That closed decades ago. So staff and the students rely principally on Alta Bates as their emergency and acute care facility. They are looking at expanding the scope of services provided at University Health Services, but that's not going to be a substitute for an emergency room. So as I noted, the chancellor has not only committed funding, but actual research resources to assist not just Berkeley, but all the communities that have been involved in this effort. The resources to do an update to the study and to really look at alternatives, so to help inform subsequent policy decisions that we'll be having to make collectively as a region. And the university has, I think, a very critical invested stake in this issue and the outcome of this issue. I think the chancellor has personally spoken out against the closure of Alta Bates, and so they have and will, I think, will continue to be a critical partner in this effort because they have no other hospital to serve their residents. The nearest one would be in Oakland or Kaiser Richmond, and that's not an adequate substitute.
I also just want to point out that, with our need for more housing and the more population that continues to come in here, that's also a critical issue of having the infrastructure to support the additional population that will be moving in here. And, it's always, the infrastructure is so much part of it that we have to be able to support that. So I don't know if there's a way to get the state more involved with that as well. Is that a possibility?
Yes, and the state does provide through one of the state agencies, the California State Hospital Finance Authority, does provide indebtedness or bond financing to assist hospitals to do projects. And Sutter has taken out millions and millions of dollars worth of financing to do projects. We believe that there is an opportunity to leverage state funding to help assist Sutter in the process of doing the retrofit of the hospital in Berkeley. I think one of the biggest challenges is that we have not gotten a complete picture of what the cost, the work associated with retrofitting Alta Bates entails, what the price tag is. They have suggested that it's financially prohibitive, but we don't know. There has not been a willingness to explore creative solutions to trying to find a way to finance that project. They've unilaterally made the decision, no, we're going to close and we're going to just move everyone to go to Oakland. But also imagine the chaos that's going to ensue when thousands of more people are going to Oakland, Pill Hill and Oakland, to get care. They have not planned for the impact of that as well. Certainly, there are things that we can do working with Sutter Health to increase access to urgent care and other preventative care, but that is not a substitute for emergency care. So, yes, I think there certainly are things the state could do, whether it's through legislation, whether it's through funding, and we want to explore those options with our state officials. I've spoken to Attorney General Bonta a number of occasions about this issue. He's aware of the importance of this. Obviously, our state legislators are also very supportive of our efforts to try to keep all debates open as well.
Yeah, I just wanted to add in the things that we have done. We actually, before the pandemic, we went up to the Attorney General. We got Becerra. We spent a year getting an appointment, and we went up there, and we sat down and we asked them, what can you do? So I just want you to know that we have really been trying to, turn over every possible stone. And I believe, Mayor, that in our settlement agreement with UC Berkeley, it actually specifies that they will help us with the Alta Bates. And so the mayor who negotiated that agreement had the foresight to literally write it in. So UC Berkeley, they're very willing. It's not like we had to, but it's explicit that they are going to be helping the city of Berkeley in our efforts to secure the healthcare needs, not just of the people who live in the city, but of the university and of the entire region. And that is the goodwill and the kind of explicit agreement that we are now drawing on to get these, world-renowned business school and School of Public Health professors working on this study that's about health, but also about looking forward. What could we do? What are the options? And when we have that in hand, I think we will be coming back to you with, more explicit asks. And one thing, just as a preview, we have anteed up our own city funds, $300,000, to put into other studies, right? So UC Berkeley is doing one piece, but we've also engaged specialized outside counsel and a specialized firm that gives advice in this area. And hopefully when we have a little better idea of what might be possible, we may be coming to the jurisdictions and asking, for a small allocation to help us kind of get to the next level in terms of researching and studying and finding models for us to move forward. So that might come, but we need to wait and see, what we get in terms of information. We don't want to come to you empty-handed and just say, that's why we're really trying to get a solid basis of information that we can share regionally, and then we can all stand on it together and find a path forward.
Thank you. Not seeing any other council comment, questions? We'll open it up to public comments. Sorry, how many speakers do we have in the room? 2 speakers in the room, 3 speakers? How many online? Okay, we can stay at 3 minutes.
Hello again. My name's Howard Graves. I spent my career as a emergency physician at San Francisco General Hospital. I want to just give you the city experience of San Francisco. That hospital was also slated for demolition, and in 2008, the city council proposed a bond measure, the largest bond measure in the history of the city of San Francisco, and this was after the financial crash of 2008. It passed by 83%. It only had to pass by 2/3 majority. There would be great public support in this whole region for a bond measure by the cities of Alameda County to support this hospital in conjunction with Sutter, or if Sutter won't play ball, to buy the hospital from Sutter and rebuild it. And I would encourage you to be very aggressive about that. Second thing is, I also worked at St. Luke's Hospital as an emergency physician, a Sutter hospital which Sutter wanted to close, again, for financial purposes. It's a critical backup hospital to San Francisco General and provides emergency care. Their ER is frequently on divert because of extreme necessity in the city, as I experienced in my career. The city council told Sutter that they could not rebuild the Pacific Medical Center, which they were required to do under city law. They would not give them a license until they first rebuilt St. Luke's Hospital and told them that they couldn't close the hospital within 10 years of the rebuild. And St. Luke's Hospital, because of that leverage of Sutter, they were able to get St. Luke's rebuilt before the Pacific Medical Center at Jack Tar Hotel, and that came from the City Council of San Francisco, and I think of the cities of the East Bay united in that way. I think that working with the Attorney General of the state, it would quite clearly be a public health emergency for this hospital, this critical hospital, to close. As an ER physician, I can tell you that the Summit Medical Center and Highland Hospital would not be able to handle the business, and they get the state to declare an emergency, and if necessary, take ownership away from Sutter and provide public bond measure, both state and local. I wouldn't play Sutter is a nasty player, and they're very much, the dollar speaks very loudly to them. If you don't have legal leverage over them or financial leverage, they'll close your hospital.
Thank you for your comments.
Miko and then Marge.
Hello, my name's Tamiko. I'm one of those East Bay babies born at Alta Bates. That presentation was really chilling. When I saw this on the agenda, I thought I would knew what I would want to say, but that was so much worse than what I could have imagined. I just want the council member to hear what I have to say, so I'll wait. You've both been in office since this closure was announced, right? They gave us 16 years notice. We're halfway through, and it looks like what you have to show for it is this study on how bad it's going to be and that you've been begging the hospital to stay. Thank you to the previous speaker for having some ideas on what to do, but you closed the presentation with a joke and a smile. Like, this is our lives. These are our families. This is not funny to us. My grandmother had a heart attack at age 89, and she lived because we brought her to Alta Bates, and she was stabilized there. And then she was transferred to a cardiac unit where she was able to get a stent, and she's still alive 6 years later when they told us she would have 1 year to live. Would that have happened if we had to drive that extra mile in traffic? I don't know. So this is really serious to us. And you brought up the state senate. We know the mayor is running for state senate. That's the joke of the presentation, that you come in here and present your failure on this hospital and then bring up the state senate race. That's an insult to the city of Albany. We're here to learn how to save our healthcare and save our community. So anyway. Yeah, that's all I have to say. Thanks.
Thank you for your comments.
Hi, my name is Margie Marks. I want to thank the presenters. They talked about the wonderful mother-baby unit at Alta Bates, but I just want to bring up that Alta Bates has a Herrick campus. And on that campus, they have units that other hospitals don't have. They have an inpatient youth mental health care unit. They have a dual diagnosis unit. That's where people have mental health problems and another medical problem that they need help with. They don't put them in with the regular hospital population. They have the adult mental health unit there. If it closes, the police will have to take every person that is 5150, for example, to Highland Hospital. They can't handle it. So I think these are like specialized things that are going on at Alta Bates you might not be aware of. There's a whole floor at the Herrick campus that has 2 patients in every room with a vent. Most convalescent hospitals don't have the medical certification to take care of people with vents. What will happen to those people? I just think it's another reason to fight to keep this hospital there. Thank you.
Thank you for your comments.
Hello? Can you hear me?
Yes, we can hear you.
My name is Nagin Mossad, and I'm the owner of Berkeley Community Physical Therapy. This is a physical therapy clinic that is serving 4 different types of Medi-Cal and Medicare in Berkeley. I know that Albany Physical Therapy recently had to sold to a corporate structure and lost the ability to care for Medi-Cal patients. There is, in fact, an onslaught of corporate greed at the bottom of all this and money-making in healthcare. We don't really have a human-centered healthcare model and structure. And the fact is that community healthcare support networks, such as local clinics, have been closing left and right in Berkeley. I know how hard it is to keep this place open. All I do is lose money, and I have gotten nothing but kicked in the back by these elected officials in Berkeley. Unfortunately, they speak a good game, but at the bottom line is they were begging since 2016, and they got Chancellor Christ to admit that she cares about the hospital, and then they got world-renowned professional analysis to present here. This is not enough, and in fact, it takes actual muscle, talking to healthcare workers and providers who are out there being closed every day, like our lifelong clinics at Ed Roberts campus that was recently closed, and all of the other clinics that are slowly closing. Yes, we will have a healthcare desert because our elected officials are too busy enhancing the ability of corporate domination in healthcare and not giving a shit about our community. Our community are, as they say, people of lower income and who have been left out are completely left out by these people. Jesse and Sophie have never talked to these people. In fact, they have called South Berkeley a colony. This is exactly where we stand today, and unless we look it straight in the face and realize the poverty that we're in, the poverty of conscience, the poverty of care of human beings, we will not be able to get anywhere just paying lip service to bigger corporate interests. The UC that, Jesse, you sold our city to, what plans did you make? Besides making 130% of your market rate development all downtown, all businesses closed, it looks like a ghost town. Who do we have to turn to? I don't think you're competent to lead this fight.
Thank you for your comments.
Hi, my name is Cecilia Avalar. I spoke earlier, and again, I just want to comment on this issue as well. You know, again, this closure was announced years ago, and so I agree with the previous comments before me. City officials should be prioritizing this since it delivers, you know, essential critical services to East Bay residents, specifically low-income residents and our communities of color in the East Bay. So because this is a critical hospital for the region, It's imperative that, we work to find solutions to keep it in service. And something I noticed was in the conversation was that funding came up a lot throughout the conversation, throughout the presentation, and then again in the council members' comments. And I think this is an extremely poignant example of why it's imperative that our local officials here, the City of Albany, City of Berkeley, that the city officials in the region work with our local, state, and federal representatives to advocate that our tax dollars and our community resources stay in the community and not be used instead to fund genocides across the world. There are no functioning hospitals in Gaza, and it seems as though our city officials are content with leaving our low-income and residents of color without accessible health care as well. If you are serious about maintaining acute services for all of our residents, then use whatever you have in your power to push for our community resources, such as our tax funding, any of our resources to stay in our community, to go to healthcare, to go to education, not more money for bombs, missiles, and military equipment, which is currently being used to eliminate another country's healthcare system, when we clearly need to take care of our own. I think the previous council member who spoke about their mom having a life or death situation and Alta Bates being right there, again, this is such a clear example of why we need to invest more in our community and not have our tax dollars fund genocides elsewhere. So this message goes to Jesse and Sophie from Berkeley, as well as the Albany City Council. Please work with your residents to divest from war and invest in community. This is clearly a matter of life or death, so where do you each stand?
Thank you for your comments.
Hi, this is Catherine Bierce. Wanted to say thank you for the presentation. It's very alarming that this could impact so many people in the East Bay. As someone taking the CERT emergency response training in Albany, I'm concerned about the impacts of natural disasters, or climate change disasters, heat waves, heat stroke, all these different impacts of the possible earthquake scenarios and other scenarios related to disaster preparedness. So I would just want to say that as a voter and a resident and taxpayer, I would support a city bond measure towards helping keep the hospital open. And it does seem like they need to play hardball in terms of getting the legal and financial support to make them stay open. And I would support a public ownership of the hospital if necessary. Thank you.
Thank you for your comments.
Hi there. I work as a doula. I work with birthing people and supporting them and giving birth. And I, like many of my peers, am extremely concerned by the presentation given by Council Member Hahn and Genocide Jesse. What is particularly concerning and disgusting to me is that the Berkeley General Fund, they used $300,000 from that to conduct a study that anyone with common sense could have told you that the closure of Alta Bates is going to create a hospital desert in the East Bay. Of course that's going to impact Black and brown people the most. And so where is the city of Berkeley in assisting with the effort? Alta Bates said that the cost of the required upgrade to meet those earthquake structural requirements was $300,000. Mayor Apartheid Araguin has been in office since 2016 when they said that that was the money they needed. And yet he's okay to approve new housing or, for example, trumpet the North Berkeley BART development plan, which the city council has approved for $53 million, but we can't find the money to fund a hospital, a life-saving hospital. And a peer just said that this is a matter of life and death, and it's clear where they stand. It's always been clear where shameful Sophie and apartheid Araguin stand. They couldn't pass a ceasefire resolution. They're constantly censoring and silencing their constituents, so much so that we have to follow you to Albany to make our voices heard, because at least this council listens to people, allows people to give comment. And then Sophie has the audacity to laugh and make a joke You are disgusting. There are no hospitals left in Gaza because people like you would rather fund the military-industrial complex and the destruction of this earth, the destruction of the Palestinian people with our tax dollars, than take care of the community right here at home. You need to take a good hard look in the mirror. You should drop out of the mayoral race, Sophie Hahn, shameful Sophie, and you, Jesse, genocide Jesse, should quit your race for senator. You should be ashamed of yourselves. And yes, Albany City Council, please do everything that you can, because you are more competent than these two horrific electeds. Please do everything in your power to save Alta Bates. The community needs it. Thank you.
Thank you for your comments. With the close of public comments, I'll look to council members for comments.
Well, I'll just offer, I think the last commenter, if I understood correctly, said that their impression was that the retrofit would cost $300,000. So I have a master's in geotechnical engineering and professional geologist, and yeah, no way. I wouldn't be surprised it's $1 billion to retrofit that campus. So it's a heavy lift. I appreciate you coming here tonight and making this presentation. Certainly has elevated my consciousness around it, and I will commit to working on it, which I have not done before. I will offer that the health impact study that was done in I guess looks like it's published in 2017. It does show, contrary to what has been stated, for now at least, that the travel time, not the time for the paramedics sitting at the hospital waiting to transfer a patient, but the travel time to the Summit campus is less than the travel time to Alta Bates, which is counterintuitive from Albany, from the 94706. I was surprised to see this. It's figure 26 has this data, and it's faster for all times of day but peak traffic in the evening. I checked that a year ago when I read this against 14 neighborhoods that are defined in Albany, and it's faster all times of day, except for the afternoon and evening in the 3 neighborhoods in the easternmost part of the city. So I just want people to know that, because I know it can be scary to hear it. Now that's today, that's not tomorrow. If Alta Bates closes, the travel time becomes less and less relevant in terms of getting into the ED. It is shocking that Sutter isn't being forthcoming. I mean, if they don't increase capacity at Summit, they're going to be killing their own members, which I can't imagine is going to be good for their bottom line. So it's just a radical community relations failure on their part that they're not saying what the heck they're going to do. Thank you again for being here.
Councilmember Tiedemann.
I'll just repeat my thanks and note, I think a big thing to discuss for Albany of household effect is, like you said, there's some impact of, where our ambulances are going and how far it is to get there, also how busy those emergency rooms are. And Albany, as one of the few cities that operates our own ambulance service, we have discussed on the council before, we are lucky to have a pretty effective ambulance service through our fire department. It doesn't matter, though, how effective our EMTs at the fire department and how fast our ambulances are if they don't really have a good hospital to take patients to. And so we need to figure out exactly how to work with this effort to keep Alta Bates open and keep that resource, because it affects how our services play out on a local level, in addition to all the ways that we covered in the presentation. Also say that I appreciate the effort to get studies on this done and show exactly how this is going to play out. If and when we go to the voters with a bond or anything else, it's going to be really important to have that detail to show why this is such an important thing and get buy-in from people about that. Bonds are getting harder and harder to pass, and while I think this is a winning argument to do it, it's still going to be one where we're going to need the background to say, well, this is the impact if we don't do it, and here's really why it needs to happen, and all of the residents it will impact, especially given that we would probably be doing that not just in Alameda County, but like you covered, given the impact of this in Contra Costa, we would have to be appealing to those voters as well. And that's a harder place to make some of these same arguments about public infrastructure financing. So I appreciate the legwork, and hopefully we can be a help in whatever form this takes in both discussing what we should do next, but also the action items eventually of what we all can do as a region to really get something done.
I want to extend my thanks to both Mayor Green and Councilmember Sophie Hahn. I think this is hugely important. I truly appreciate your efforts when this first came in front of you all, and the efforts of former mayors, Peggy McQuaid and Rochelle Nason. And I think we all during COVID had many things that came to the forefront, and I would have hoped that COVID of all things would have shown Sutter Health just how important their campus is, just how important such an infrastructure is. I recently came back from a conference, and the mayor of the host city mentioned something that one of the most important things that a city council and a mayor can do is to look out beyond the length of their term and understand the things that they have to do to make sure that their community is set up for success. And the renovation or construction of a hospital is a very long-term look. And I think I want to really thank Councilmember Hanson Romero for raising something that I think is super important, and I hope that the studies will also show is it's not about only our residents today. It's about the expectation of the population growth that will happen in the region. And if the RENA numbers are able to be met across the East Bay, that is that many more ER visits, that many more hospital beds that are needed. And the idea that we are closing a hospital is shocking. I will also thank the comments about mental health. As a family, we have been bounced around many of the regional hospitals that provide mental health care, and they are all at capacity. And the services that are provided locally made it easier for us as a family to visit our loved ones. It made it easier for our loved ones to access on their own, by bus, outpatient services that were provided by the same group of doctors. And so, I think this is a really important thing for us all to keep in mind, and something that I look forward to continue work with the City of Berkeley and our neighboring communities to find solutions. And with that, I will say thank you to the mayor and council member, and we will close this presentation. Thank you.
Mayor, can I request, seeing as I think our next item is going to be a fairly hefty one, if we take a brief bio break?
Yes, why don't we take a break and we will reconvene at 9 o'clock.
Sure, thank you.
Thank you, everyone. We will reconvene the meeting and move on to item 10.1, Keynes and Adams Bikeway Pilot Evaluation. Turn it over to city staff.
Thank you, Mayor. Good evening, Mayor and Council. Justin Freed, Transportation and Sustainability Manager for the city. Also, since there was a new name on your staff report, and since I'll put a face to the name, Ben Matlaw is Associate Transportation Planner in our office and helped prepare this report. So presenting tonight on the Keynes and Adams Bikeway Pilot Project. Brief background here, run through the city goals associated with that. The Climate Action and Adaptation Plan has a 25% reduction in vehicle miles travel goal by 2045. And the 2012 Active Transportation Plan sought to double walking and biking mode share by 2020. Next slide, please. The Active Transportation Plan calls for bicycle facilities parallel to San Pablo Avenue on Keynes and Adams, providing north-south vital north-south routes to the citywide network, as well as some cross-county north-south routes. At the plan adoption, the proposed projects were identified for additional study. And if you go to the next slide here, some more background on the project. That study was completed in 2017 with a recommendation from council to refer back to the Transportation Commission to develop the design as a pilot. The pilot was approved in 2019 and included in the capital improvement plan subsequent to that, and was installed in early 2023. So it's been approximately 14 months since work was substantially complete on the project, and we're bringing evaluation of that and recommendation for a path forward. Next slide, please. The other context here is that staff has identified this project as a good candidate for an active transportation plan program quick build grant, which has a rapidly approaching deadline, which is why we're seeking direction tonight. Next slide. So the pilot design, which is what's in the ground now, permits two-way vehicle traffic internal to each block, with barriers restricting entrance for motor vehicles to essentially maintain the prior one-way through traffic direction on both Keynes and Adams. Cyclists are permitted to proceed through those barriers and therefore have fully two-way bidirectional access along Keynes and Adams for the blocks of the pilot. Next slide has a picture, what it looks like on the ground. This is post that cyclists pass through, and just a note, there has been discussion on communication and making it clear what the configuration is currently. The sign on the right there was added several months after the pilot was put in to indicate two-way traffic, and recently all vehicles signage below that was installed to further clarify that for motorists. Next slide. So some data from the evaluation. We've done some bicycle and vehicle counts before and after, as well as we'll present on some survey data. So the bike counts are mixed. These are 24-hour counts, so they're just a one-day snapshot. So there's, variation between the days of the, 3 days that have been sampled. Small sample size, could be a mix of that and reflection of change in behavior. We don't have a lot of information, but generally it's showing increases at Solano for all three, on San Pablo, on Keynes, and on Adams, with more variation in the collection further to the north that we did, where it was a drop on the Adams side that recovered between the 3 data points, saw drop in on San Pablo and an increase on Keynes in the north. Next slide, please. Not much change in the vehicle volumes, with some utilization seeing of the new exit direction, the bolded 20 and 49 there. Our increases in entering in the intersection now in the contraflow direction that's now permitted. There was one block that did see a pretty high change in the 24-hour vehicle volume number we got from looking at the intersection. So most of our traffic surveys are 3 days that give us a little more data points. So I'm not sure how much of this is variation, but that was the most substantial change we've seen in the data, was that Keynes north of Solano block there. Next slide, please. And we have a few more data points to put that in context. We did 3-day vehicle volume counts for the blocks between Solano and Marin and Solano and Buchanan, as well as the blocks between Washington and either Portland or Castro there. The numbers in purple are on the corridors, average daily volume, and some other counts we've done in the past to provide some context on adjacent streets. So we also did a recent survey that went out in advance of the Transportation Commission notice to all residents of Keynes and Adams, and we circulated more broadly to get additional users of the facilities. We received 155 responses to the survey. A lot of folks used it every day or multiple days a week in the response, people who responded to the survey, with use very high in both driving and walking, and approximately half of the respondents indicated cycling on the corridors as well. Next slide. The main feedback regarding the conditions with the pilot that we received really focused on confusion around driving and parking, rules and behaviors, what's allowed, speed of motor vehicles, and safety concerns at intersections. The council has heard, and other responses we've gotten at prior discussions also discussed experiences of discomfort and harassment, utilizing the roadways with motorists not understanding the rules, or continuing to navigate the roadway as a one-way, like in the center of the street, and the safety concerns with that. Next slide. We also asked surveyors to talk about their preferences for future changes, and the highest preferences were for traffic calming, converting the block back to one-way vehicle traffic, and creating safer crossings for cyclists at intersections. So talking a little bit more at street design, I'll go through this briefly. There was more information in the staff report. The Transportation Commission recommended, the staff recommended Chicago contraflow design option, but did recommend consideration for 2 other alternatives that were presented to the commission. And these 2 were leaving the existing pilot, which involved pursuing legislation to allow left wheel to curb parking, and the other of going to fully 2-way streets with forced right turns to prevent multiple block-through traffic on those streets. Next slide. So the presentation, the staff report discussed a little more in detail here, but the high-level picture of why staff's not recommending these is the first one, the existing pilot, leaves that parking configuration unresolved. There's still, most vehicles are parking in the one-way direction currently. That is counter to state law now that it's internal 2-way streets. You're supposed to be parking with your right wheels to the curb. The second one introduces additional 2-way motor vehicle circulation and pretty significant changes to local circulation and access. So that we felt required looking in a lot more detail, block by block, for that to happen across the whole, both corridors. And the introduction of two-way motor vehicle circulation, one of the benefits folks responded to as cyclists, there was an indication that a number of cyclists felt more comfortable on these roadways because they were only anticipating most of the vehicle traffic to be approaching in one direction. So while this may have the benefit, I'll talk a little more about the pros and cons of the final alternative here of allowing the full width of half the roadway for a cyclist traveling in the contraflow direction. The downside here is that you do have more vehicles approaching in both directions to contend with as a cyclist. So the staff is recommending what we're calling the Chicago contraflow lane here. Here's some examples of it in practice. It has been put in place on a number of different streets in Chicago, which is why we decided to describe it that way, the top two there. But there are other cities that have it. Here, there's an example in Cambridge and one closer by in downtown Santa Cruz. The Santa Cruz example is a few feet wider than Keynes and Adams. But since it's more of a local and downtown example, we figured that it's a good one to show. This one involves fully one-way motor vehicle traffic like existed prior to the pilot. Cyclists traveling in that one-way direction would share the lane with the motor vehicles. It would be a narrower 10-foot lane versus currently where you're supposed to be on one side, but it's essentially an open 16 feet between the parked vehicles. And then for cyclists traveling in the contraflow against the one-way vehicle traffic direction, there would be a striped bicycle lane. Next slide. So there are pros and cons. It's not just clearly one is better than the other. This would revert back to the prior motor vehicle travel pattern, which there was a strong preference for amongst a subset of the respondents. It does narrow the travel lane beyond what you currently see there, and potentially helps keep vehicles within that lane versus taking the center and slowing down with a narrower striped lane. It does retain the existing curbside parking and clearly makes it legal to park in the one-way direction on both sides of the street. And it does provide dedicated space for cyclists in one direction. And by not having any motor vehicles coming the other way, that would potentially speed up emergency responders not having to contend with someone stuck approaching when they're trying to get down the street. Cons, it does place the cyclists in a position where motorists do not expect to see them as much, given the one-way motor vehicle traffic. It's less of a change from current than it was from what was there before the pilot. It does require the motorist to cross the contraflow lane if you're parking on that side. It does still have an open 16 feet just with the striping, so it does have potential use by motorists to overtake a cyclist in the direction of motor vehicle traffic. And there is a limitation between left-hand side parked motorist or someone exiting a driveway on that side and a cyclist in the traveling in the contraflow lane in the opposite direction. Next slide, please. It was studied extensively as part of the study that was concluded in 2017. It was one of the concepts that was developed. It just wasn't so it had some vetting and community discussion at that time. And next slide, please. So here's a visual of what I was describing of the main safety concern that was identified in that report was this visibility with a cyclist in the contraflow lane, and there was a preference to give the cyclist a full half of the roadway width traveling in the contraflow lane to help reduce that risk. I think given the experience that was described and observed of many motorists treating it as a one-way open width street, some of that concern is counterbalanced by more motor vehicles traveling on the street and the potential for that to be the more frequent safety concern and conflict point than this situation here. Next slide, please. So just summarizing the recommended design for the cross-section here, we feel it really helps clarify the permitted vehicle movements and parking, the confusion piece that has been a big part of the feedback we've received, keeps the motor vehicles moving in the original one-way and permits the left wheel parking. It provides a two-way cycling facility, which was the main objective of the pilot. And it adds dedicated space for cyclists in that contraflow direction. And then it has the potential to improve safety with that narrower vehicle lane, opportunity to reduce speeds potentially with that and speed up emergency responders. So beyond the cross-section piece of this, we are recommending a few other components be included in this next round. Next slide, please. One is wayfinding signage, so takes various forms on a bicycle route, but confirming that you're in the right place, that you know you're able to navigate as you're staying on the network, really build this into the rest of the cycling network in the city and include it in our decision signage that we currently have on most of our bike network. Next slide, please. As well as really advising motorists of the facility as they approach it to improve awareness and safety for cyclists crossing, as well as clear direction for motor vehicles on proper use of the facility. Next slide. So we're also recommending including various intersection treatments and other traffic calming measures being included. I showed the measures of vehicles on Canes and Adams, but there's also a lot of motor vehicles on those cross streets, and so getting folks safely across. We have fewer east-west streets, we have longer north-south blocks, so there are, we feel like this is the key next step, is really improving the safety at crossings. Next slide. So what we're wanting to include in our menu of options, varying intersection by intersection as we get more detailed into the designing of this, would be, where is it appropriate to have speed tables for speeds on the blocks, changes to stop controls, and flashing beacons or traffic circles to help get cyclists through cross streets and along the facility. Next slide. And then the other piece that really came up, particularly triggered by that higher number on that block of Canes, was part of the Transportation Commission discussion, and really why the two-way with a lot of right turn diversions was part of the discussion. Are there things we should be doing to really reduce cut-through traffic on these blocks? So we are recommending, that we take a look at traffic volume management, what this would look like. Could be a couple different things. One would be, not every block like we were looking at with the fully two-way, but is there a place where it makes sense to do a right in, right out only at a location to reduce the number of vehicles that are going multiple blocks along one of these streets? That would have access implications for folks on that block, especially since we're one block off of San Pablo. Only certain of these intersections in San Pablo are signalized, so it is something we would need to look at more closely. But given the concern both in respondents and in the commission discussion around the volumes on the street and the safety for cyclists, as well as the local resident interest in traffic calming, to look at that. And so we did include also next slide. Besides the right in, right out, the other option that was part of the toolkit in the study as well was alternating one-way streets. This would basically mean the one-way direction would change one block to the next, so you couldn't continue multiple blocks. This would also have different circulation and access implications. It would also mean that it would be a less consistent cycling facility because you would be one block in a contraflow lane, one block in the shared. So it would be more complicated and get more in the direction potentially of the legibility confusion that we faced with the pilot. But that's the other alternative we see for traffic management, or volume management here. We do think we should focus looking at just a few blocks if we were going to consider this. And so next, I guess it was the previous slide. Really, it's for Adams Street, looking at the block between Solano and Buchanan, where it's got the highest volume. And then for Keynes, we recommend looking at it from Solano to Portland, one of those two blocks. The block between Solano and Marin is already going to be getting the right in, right out median refuge on Marin as part of the Alameda County Transportation Commission project. So, that one's already to some extent limited in terms of what other additional volume management we might do on that block. So with that, I will just emphasize we're seeking a resolution that directs us to prepare designs, as I just detailed, with those elements, including the measures to address vehicle volumes. We want to confirm that there's interest in that, and to authorize city manager to submit a grant application. And with that, I'll open up to questions.
I'm going to be a little out of character and ask if I can ask the first question. Thank you for the presentation. Really appreciate the effort you've been going into really address community concerns, Transportation Commission concerns. One question that's really more about logistics. We will, if this resolution passes, we would apply for a grant. To what degree does the city need to have the plans? Is it a conceptual plan? Is it a 30%, or is it like full blown out designed plans?
For the grant application, we don't need fully baked plans. We would like to get as much direction as we can, so that we can put in much detail as we can in the grant application and be as competitive as possible. But you don't need, this is a fully designed project, and we just need the money.
So then the follow-up question would be, we direct you to produce a plan, you produce a plan that's submitted for a grant, we win the grant. How much flexibility do we have in, for instance, if we were to go with the option 4 as proposed by staff, how much flexibility do we have in whether or not it's a traffic table or a mini traffic circle that's installed? Like, is there leeway in terms of the fine grain detail as we move forward?
Yes. We would like to know if there are elements that should or shouldn't be included in what we are submitting a grant application for, so we can be clear with, and deliver what we promise. But we don't need to show every location if we're not ready to say it's definitely going to be this element at this location.
Thank you. That's it for my questions. I do have lots of comments, but that's it for questions.
Now we're in your professional realm. Thank you staff for the work on this, for finding this solution to the current situation, unearthing that from the past. I think I know the answer to this question, but even if I do, it's a good one to have out in public. Why is it legal, or why is it legal for motorists to park left wheels to the curb with a conflow cycling lane, but it's not legal in the current configuration?
It is legal when it's on a one-way street. So if it's one way to motor vehicles, our interpretation is that you can park in the one-way direction. But because our current configuration essentially created two-way streets, that changed what you're allowed to do.
Okay. I come back to that because, I mean, people riding bikes are riding vehicles. So in a sense, it is a two-way street. But anyway, I'll come back to that. In your conception, would this cycling lane, contraflow lane, if that's the choice of the council, would that be a green lane or just a regular, white stripe, white symbols, asphalt lane?
We've done the green skip striping at conflict zones, but I think it's up for discussion whether we would do full length or just emphasizing where there are conflicts.
Okay, thank you. And then are bike boulevard symbols contemplated in the shared lane direction?
Yes.
Okay, thank you. That's it.
You mentioned that there are some other cities that use this contraflow bike lane with parking next to it, and the concerns around that. Do we have any data or reports, anything from other cities that use that to show, is it materializing as a large issue around the pulling out of parking that's sort of parked with less visibility, like you mentioned?
We haven't come across any post-project data yet on that. It's something we could try to ask more cities directly and see if they have that information. Amongst the facilities we have to choose from, it's generally not the first on the list. I think it is in the context of comparing it to the internal two-way configuration we have. We're comfortable recommending it given the issues that have been identified with it. But if you had options that didn't introduce that conflict, we would prefer that, but it has a higher cost here.
Any other questions? Sorry, and not seeing any other questions from council members, I will like to see how many do we have in audience and online? City Clerk, sorry. Any speakers in the audience? Okay, so 2 speakers in the audience, and how many online?
Currently 6, but people will raise hand after.
7. If we follow precedent before, if we could have 2 minutes for each speaker, please.
Okay. Go ahead.
Good evening, I'm Peggy McQuaid, and Ann, I will get you a speaker card in our lifetime. I'd like to start by expressing my gratitude to you all and to staff for listening to the concerns of the community. You've received a lot of concerns over the last year, and you're reacting, and I really appreciate that. I think going with the contraflow bike lane makes the most sense, but I do have a question about the timeline, and I hope that you can at least unwind what you've already done. Take out the bollards, take down the signs that are there that talk about two-way traffic. I like the idea of a whole green lane painted the entire street. I think that's really important. And to do that now, and then the other pieces, which I think will probably need a little bit more study, to do that incrementally as the studies are completed, as funds and staff capacity allow. I don't like the idea of changing the way the street goes every block or every couple of blocks. It's confusing now. Don't make a bad situation even worse. And if you are going to think about that, it's going to require a lot of study and a lot of conversation with the residents. Thank you.
Thank you for your comments.
Okay, hello council. My name is Bryce Nesbitt. I actually live just across the border in Berkeley, and I normally wouldn't come to any Albany thing, but Solano Avenue is the shopping district. It's an important route. I want to let everyone know that there is a new traffic sensor on Canes. I'm holding up some data from that. It's counting 24/7, both speed, volume of traffic, including pedestrian and bicycle counts. Now, when I think about Canes, the problem pre-project was speed and volume of traffic. And unfortunately, going to this new contraflow solution, which is, I know there's trade-offs. I don't happen to like these trade-offs. But that it's not solving either of those two problems. We can expect essentially the same speeds and essentially the same volume as the pre-project. When the Canes two-way came in, it was really exciting to me because the potential was for actual two-way traffic, because that changes how people see the street. Yet the project that ended up being delivered, as everyone says, reads like a one-way street, speeds like a one-way street, feels like a one-way street, and that I say that as a car driver and a cyclist. Doubly so with those hard white lines on the edge. It looks like you ought to be driving down the middle of it at high speed. So I think there's a lot that could be done short of the contraflow lane solution in order to work on those more fundamental issues with the street, including diverters, signage striping, those kind of things, in order those soft solutions before you end up on the solution that everyone thinks is kind of the best but not particularly great. I encourage you to look at those and give those a test and go for volume. Just super quick, Berkeley has done really well at taking selective diverters, there's not a tremendous number of them, and getting people onto the main streets where there are traffic lights and things like that. And it's really worked, and in Albany it's much more of a grid. And that's what we're getting, the grid. Thank you.
Thank you for your comments.
Hello.
Yes.
Can you hear me?
Yes, we can hear you.
Oh, thank you so much. This is Danny Lanis, Advocacy Manager at Bikes Bay. I would like to say that Bikes Bay takes the same position as Albany Strollers and Rollers, which you will likely hear later, suggesting to move forward with the contraflow bike lane with the added considerations that are also listed. The upcoming Alameda CTC San Pablo Avenue Corridor project adds a diverter at Canes and Marin and constitutes a good example of what we would like to see on the corridor. Thank you so much. I yield my time.
Thank you for your comments.
Hello, this is Ken McCroskey, one of the absent transportation commissioners. Sorry. I wish I'd been at that meeting, but life intervened. In general, I think the staff has come up with a great proposal.
I'm just going to offer we're having trouble hearing you. I don't know if you can get closer to your mic.
Thank you. Is this better?
It is much better. Thank you.
Great. Holding the mic to my mouth. So this is an area that's been under consideration for a long time, and currently the numbers are kind of low for usage, but a lot of that is due to the fact that there aren't good connections like the one proposed at Marin and Canes that will come later. This is part of a long-term process. I think staff's come up with a good program for the grant that allows a lot of mitigations and adaptations that will answer some of the questions that we've heard, some of the complaints and letters. And the Strollers and Rollers did come up with a statement that we have confirmation got to the commissioners. I'm sorry if that wasn't made public, but in this essence, we support the option of contraflow lanes with a little further study and discussion of traffic markings. Further, we'd love to see the pilot maintained with access in two directions for bicyclists until a replacement measure that allows two-way movement for bicyclists is implemented. Thank you.
Thank you for your comments.
Hi, my name is Brian Martin. I live on the 600 block of Adams Street, about a half a block from the bowling alley. And so I think a lot of people in my neighborhood are hoping for better bike infrastructure, cycling infrastructure, micro-mobility infrastructure, because we know the bowling alley project has a lot of units planned that will have no parking, and the new zoning on San Pablo allows for huge developments to be built with no parking. So the easier it is for people to get around, the safer they feel, the more calmer the streets are for cyclists, for scooters. The less they'll be on our sidewalks, and the more people will be able to live with fewer and no cars, and help us all out. So this infrastructure, I think, is really important. I think connections to the north and south are also important, which is not on the agenda for tonight, but should be brought up soon. I am fine with the contraflow bike lane, the staff recommendation. I think I think it solves a lot of the problems. I also agree with people that it doesn't address the volume of car traffic and the speed of car traffic. I would not be in favor of diverters, though, with this plan, because it would mean that people could only, on my block, for example, approach from San Pablo Avenue to turn right onto Adams Street. But I would be in favor of two-way with diverters on every cross street. I'm also in favor of other things that make cycling a higher priority in our street. My wife bikes to work every day. My daughter is going to be living with us soon and is planning to bike to Alameda every day down our street. And the more cycling infrastructure that we have, the better. Thank you.
Hi, it's Catherine Bates with ACAC. Want to say thank you for this research, super interesting. Not quite sure I understand the exact implications of all of the pieces, but I just wanted to comment that I use the bike path on Canes myself. Appreciate having the attention to biking and walking as a priority for Albany. My concerns are about that bikes being in the door zone, that being it shared with cars, not having a protected bike lane could be an issue in terms of injuries for bicyclists, and I want to keep people safe. So Milvia, in parallel to Shattuck in downtown Berkeley, is a good example of having a dedicated protected bike lane near downtown with one-way car traffic. It's shared with cars in more residential, quieter areas. So also want to mention, it's not on the slides, but having a bike path on Solana would be great as well, because that's an area, it's hard to kind of get around downtown using adjacent streets like Portland or Marin, and would like to know more about that in the future too. So just want to echo the concerns around safety, and however that happens best, I'll leave it to the staff, but wanted to just mention that as a concern. Thank you.
Hi, good evening. Ian McLeod, I'm the current chair of the Planning and Zoning Commission. I'm speaking on my own behalf, but I'd like to say that I do support the change to option 4. In fact, what you have now is a de facto similar system. It looks like a one-way street, feels like a one-way street, two-way bicycle flow. It is a de facto Chicago contraflow situation right now. So is going to this other system with the Chicago contraflow is not a big change really from the pilot program, but I think it reduces a lot of the confusion and takes away some of the negatives. You know, the cons mentioned by Mr. Freed are really not much different than what we have now, and as far as I know, there are no conflicts in that regard, or very little to no conflict at all with those cons that he mentions. The pros, the potential parking violation conflict just goes away completely. No more confusion, no more conflict, no more trying to get the police department to ignore the law. I think that's a really big, important change. I support the traffic calming measures proposed by staff. Milvia between Cedar and Hearst and Berkeley is a great example. They've got planting bulb outs, they've got speed tables. The street meanders a bit. There's some parking reduced to allow that. That could be done creatively where there are long stretches of driveways. There's lots of things that can be done to calm traffic. I think it's more than just paint on the ground, much more than that. You need to create an aesthetic, pleasing boulevard that will be used by many people and I wouldn't ignore aesthetics. Big picture, we need we need transit-oriented development all across town. We need protected bike lanes on San Pablo Avenue. This parallel route is important, but it's not sufficient to a real true bicycle network in Albany. Thank you.
I think it's obnoxious that this is being limited to 2 minutes. My name is Clay Larson. I live in the 600 block. Just quick comments. I think an objective review of the data shows that this was a failure. There was an actual decrease in bicycle trips in most of Adams Street, a small increase on Keynes, but a large increase of bicycle trips on San Pablo Avenue. So the goal of the project to provide a lower volume alternative to bike travel on San Pablo was not achieved. I was disappointed in the surveys. The city made no attempt to reach out and survey residents on Keynes and Adams. The new proposal, the contraflow bike lane, is actually going to be more dangerous for bicyclists. By requiring or encouraging bicyclists to ride in a narrow 5-foot lane immediately adjacent to the parked cars, the chances of collisions go up. The 2017 Parnassus Transportation Consultants rejected the contraflow. In 2019, the city staff characterized contraflow parking as dangerous. If it was dangerous in 2017 and dangerous in 2019, it's dangerous now. There's some vague mention of intersection improvements, not much detail there. But the goal was stated to meet NACDO bicycle boulevard requirements. These aren't bicycle boulevards. If you look at the resolution approving the pilot project, they were called bikeways and bicycle routes, not bicycle boulevards. More importantly, bicycle boulevards is a technical term that means a street where bicycle traffic is given preference over vehicle traffic. The data show that there's 20 times as much vehicle traffic on the streets as bicycle traffic. Thank you.
Hi, Nick Peterson, avid bicyclist in Albany. I go up and down Keynes a lot, a little bit on Adams also. I think you can tell from the comments that there's no perfect solution here. You're not going to make everybody happy. But I support the contraflow. I like the idea. I agree with Peggy McQuaid. Let's make it green. Let's make it really apparent. Let's get rid of that double yellow line going down that looks like a landing strip and you can just rip along in your car. I think the more we can make it visible that bikes have a privilege to contraflow, that's an important thing to do. As a bicyclist, I'm always very cautious when I counterflow, but I can tell you someone pulling forward is no worse than someone pulling out, not looking back, or dooring you by swinging their door open, even though they're aimed in the same direction you're going. Also, right turners that don't pay any attention and will clobber you too are just as bad. So it isn't perfect, but I think it's a good next step. And I believe I would like the staff to correct, the last speaker said that there was an increase on San Pablo, and I think there was a decrease. So, but maybe I was wrong. Anyway, thank you very much.
Hi, I'm Amy Smolens. I've lived on the 900 block of Keynes for more than 30 years. I walk and bike and drive on Keynes at all times of the day and night, multiple times a day. I'm self-employed, so I spend a lot of time at home looking out my window and in my front yard. It's obvious that the bikeway is working well for users. I see constant bike traffic in both directions. People run the gamut, ages and abilities. I see kids biking to baseball practice or school, parents with their cargo bikes, toting kids and groceries, seniors riding to shopping in the Y, everyone in between. Regarding emergency vehicle access, remember that nearby parallel streets are identical width and have two-way traffic, so that's irrelevant to this discussion. If anything, contraflow parking is safer for bicyclists. Drivers are facing oncoming cyclists, open their door toward the sidewalk, reducing chances of dooring. City of Berkeley staff stated that in almost 40 years of similar configurations in Berkeley, they recalled no accidents or incidents due to contraflow parking. So this really has been much ado about nothing. If you feel like contraflow parking cannot be deprioritized, although that's worked fine in Berkeley, I support the contraflow lane as the second best alternative with the most visible, greenest, widest bike lane possible, so we're the farthest from the people exiting driveways and drivers respect the lanes. Whatever you choose, please make these bikeways safer for users of all ages and abilities. Enhancements, red curbing, stop signs on cross streets. Drivers speed on one-way streets, so speed bumps, neighborhood traffic circles, all will slow traffic and enhance safety. Whatever you do, enhance the Keynes and Adams bikeways so Albany has low-stress north-south corridors paralleling San Pablo Avenue. Please do not undo anything until you're ready to implement the new cycling plan. We need this for Albany. Follow your own mandate to reduce climate change. Thank you very much.
Yes, this is Lucinda Young. I am a commuter bicyclist, and I frequently use the Keynes route. I would say probably 4 or 5 times a week. I personally have not had problems with that route as a cyclist, other than crossing Marin can be difficult. I often have to dismount to cross through as in the pedestrian way. But I just want to express my strong support for safe bike routes. It's really an essential part of our climate action and adaptation plan. We've got to reduce car trips. That's not going to happen without safe bike routes. So please prioritize safe bike routes. It's really essential to realize our climate goals. Thank you.
I want to thank everyone for providing comments tonight. I really appreciate everyone speaking up. Sorry. I will open it up for council comments and discussion.
Yeah, there was a question from a commenter we know well regarding what is the timeline for doing changes on these streets.
We're not proposing changes until we have a project to implement.
Okay, so it would essentially all be done at once the design is complete, rather than say painting the contraflow lane and then doing other parts later.
That's the current proposal, but
okay,
it's not a project with the funding and budget and schedule yet.
Yeah, okay, thanks. I want to thank staff for getting the all vehicle signs up underneath the two-way arrow signs. Hopefully motorists who are going the opposite of the previous one-way direction can point to those and actually get others to agree that that is in fact reality. A commenter represented, well, we heard commenters saying number of bicycle trips have gone up, number of bicycle trips have gone down on San Pablo. I'm wondering if the city clerk could put up a slide that I prepared to try to sort this out for myself, because I ran into the same questions. Thanks. So what this shows is the counts on San Pablo on the left, on Adams in the middle, and on Keynes on the right. And it basically sums the counts, the northern locations and the southern locations, or the Solano location and the northern location. So it's to try to reduce the noise that seemed to exist in the data, with counts going up in some locations and counts going down in some locations. And so interestingly, you look at the corridor and the number of trips is constant on San Pablo, constant on Adams. At each time step of the two subsequent measurements, it went up on Keynes. Last count, it was up 60% compared to the baseline. And I think that's not surprising, because it actually has connections at both ends, and it takes people a while to discover it. And in fact, various mapping programs still don't show it correctly, so it'll take even longer to for people to discover it and realize that that's there. To me, this is a win. This is what we want when we create cycling facilities. It actually induces demand, much like building lanes on a freeway. And so yeah, I just wanted to sort that out. Yeah, sure.
Because while you have the slide up.
What?
I just wanted to make a comment.
Oh, yeah, sure. Yeah.
I think this is really important because, you know, I think there are very distinct differences between Keynes and Adams. Adams at the northern end of the city, completely blocked off, can't really get across the creek. So southern end, once you get down to City Hall, it's essentially blocked as well. And so the level of through traffic one might expect on that side, let alone the fewer amenities on that side of San Pablo, I would have guessed what it shows here, that there isn't nearly as many and that you wouldn't have nearly as big of a pickup. But again, as I mentioned earlier tonight, I think, you know, when you think, as we as council members have to, 20, 30, 40 years down the road, the Albany Bowl project right now is on hold. It will be built someday. It might be next year, it might be 5 years. It might not even be that same exact project, but something is going to get built there. And that will suddenly be a larger portion of people maybe choosing to ride on Adams because maybe they're taking their kids to Ocean View Elementary School. Maybe they're going down to play baseball in the UC Village at the Albany Little League. But I think the big key here is Keynes, right? Keynes connects us very closely to Berkeley. It connects us to Solano Avenue. It connects to all the backside of the San Pablo Avenue bars and restaurants and stores that are opening up. And so I really appreciate this data and the way that you represented it, because I think it is not surprising to me that Adams didn't have as much as a pickup as Keynes did, but it's helpful to see that Keynes actually has had a significant pickup.
Thanks. Yeah, and I'll maybe build on that and saying building these facilities in urban areas is a step-by-step, segment-by-segment process. So at the point in which Adams does connect to the cycling facilities on Carlson, which is a long-term plan, then we'll probably start to look more like Keynes at this point in time. And I'll just compare that to the 20-year effort to build the cycling and path facility along Cordonesis Creek, of which the last segment between 8th and 10th just opened. I'm probably 20 years, I don't know, about that long since the first segment opened. And just a couple of weeks ago, the connection to the Bay Trail just opened. So it took 20 years to get it done. Hopefully this won't take as long because we got to that one last piece. A commenter said that the Conflow cycling lane would be 5 feet wide. The design is actually that's in hand already, which isn't necessarily the final design is for a 5.5 foot wide cycling lane along a 7 foot wide parking lane. Almost all the cycling lanes on local roads in Albany are 6 feet wide along a 7 foot wide parking lane. So this is only slightly narrower. And against that, if you look at the commute to work data, there are about 10 times as many motorists who drive alone as have a passenger. And so the chance of getting doored is that much lower because people in the Conflow lane will be on the passenger side of the vehicles, for which there's very, that much less door opening and closing. Further on the safety matter, I was concerned about that, so I went to Pastime Hardware and bought $5 worth of chalk a couple months ago and chalked out a Conflow cycling lane so I could get a feel for what that actually is going to be like. And something I hadn't realized, because we were always looking at that map figure that shows the motorist and the car's blocking the view, is that it's not a 2D problem. The way it's shown on the maps, it's actually a 3D situation. And so, at least for adult riders, you actually have much better sight lines to the motorist, even though they're on the left side of the car over by the curb, than you would think, because you're looking over the trunk of the car and over their hood. So that made me feel more confident. Additionally, since this was first taken up and then passed as a pilot, the 11th edition of the Manual on Uniform Traffic Control Devices has been issued, and for the first time it has Conflow cycling lanes in it. My understanding is that those manuals only include, and I guess I should say, this is the manual that is essentially the standard for transportation engineers. So they generally don't recommend things that aren't in there and are comfortable recommending features that are in there. And my understanding is that features are not included in that unless they've gone through extensive pilot testing and been found to be safe. So the fact that that was included in the 11th edition tells me, you know, we can have more confidence that this is a safe option. And let's see. So in terms of features of the project, since this is an opportunity to say something about that, I would like to see stops installed on the cross streets for Keynes and Adams. Currently at Dartmouth, there's no stop sign for 4 blocks. So that would seem like it would be an easy one to do. The pattern throughout almost the entire city, except for Dartmouth, and I'll talk about Adams, is to have a stop sign every 2 blocks. I'd like to see a stop sign on Adams at Washington and on Washington at Adams and on Castro at Adams, because those have 3 blocks without a stop sign, which again is not like the pattern throughout the rest of the city. So I don't know why those neighborhoods shouldn't have the benefit of having those stop signs, which will also help people who are trying to cycle on those facilities. And then in addition, a stop sign eventually at Clay and Adams, which would only be 1 block away, but you really need the stop sign at the top of the hill on Clay because it's such a steep rise. So the sight lines are quite odd right there at the intersection with Madison. And then for stop signs on the cross streets of Keynes north of Solano, I would like to see the stop signs on the cross streets of Stanage move to those locations and neighborhood traffic circles put in along Stanage to maintain that lower motorist flow. And we already have a plan long ago, but we have the drawings for a neighborhood traffic circle on Stanage at Dartmouth. So I would like to see that included as well. That one's already in the can, it's been designed. The 900 block of Keynes, because it is going to get a full median diverter from the Alameda County Transportation Commission at Marin in, we're saying 2025. I don't know if it'll actually happen then. I think that block needs to stay 2A the way it is now, and when that median diverter goes in, the bollards at the south end would be removed. So that would allow motorists to be able to turn right off of Marin onto that block, and then turn right out of that block onto Solano. And so that would mean that people could park on the east side without having to make a multi-point turn mid-block. If that isn't done and it's only one way north or one way south, then motorists who live on that block are going to have to turn right. All motorists who live on that block are going to have to turn right to San Pablo, which I don't support. And yeah, with that, those are my comments. Thanks.
So first, thanks to staff for all the work they've done on this. This has been a long process, and I appreciate all the work that's gone into it, as well as all the thinking about figuring out how this is all going to exactly work. And I appreciate the mayor's comments of, you know, in this and all policy, we should be thinking about long-term stuff that's going to, you know, affect our built environment long after none of us are on this council anymore. With that, I'll keep my comments fairly brief. I'm completely fine with and support the recommendations. I would agree with some of the comments made that the Contrafort bike lane be, you know, brightly colored, as wide as possible to really show that it's different and make it visually distinct. For traffic management, I am not as much of an expert on this as some members of this council, but I'm personally a fan of roundabouts. I think they give the best of a lot of worlds for managing traffic, and would support their use for that in the streets here. I will just add a caveat there that if I see a stop sign used at a roundabout, I will go insane. And I have to mention that because whoever designed a lot of the roundabouts in our neighboring city didn't really understand how they worked and put a lot of stop signs there. So I just want to emphasize that we need to design them the right way. And I have full confidence in our staff to do that, but for my future sanity, I need to mention it.
I will second my appreciation of staff for both being, for moving forward with the pilot program and being flexible in its implementation. and for really listening to the community. And when you went to Transportation Commission, you provided a plethora of options. And I think that is very valuable. It is a lot of work, but it's very valuable for people to be able to see and understand ideas they've heard or they're thinking about, and see that staff has looked at each of them and what are the pros and cons. And so I truly appreciate the efforts that staff went to do that. A comment was made earlier that, and I have often said this, don't let the perfect get in the way of good. In my perfect mind, we would be going with option 2, and we'd already have it figured out on how to do median diverters, and that would cut down on traffic and allow bicyclists to feel safer. But there are a lot of questions. I mean, I think that easily works on Canes. I have lots of questions on how that would actually work on Adams. And understanding that the staff has an opportunity to go for a grant that can get us funds to implement this faster and sooner, and knowing that what we are proposing in the grant would not prevent us in 10 years or 20 years to reconsider traffic patterns again as traffic volumes go down, as fewer people are riding in vehicles and more people are biking and walking. While I think fundamentally would love to be in support of 2 and spend millions of dollars doing a study and implementation, I think 4 is the pragmatic approach to get something done now. It does not force users currently today to change their perceived use of Canes and Adams. And so I think it moves at the speed of trust as well in terms of what our community has said. I do agree with the comments that were made by Councilman Jordan about the movement of the stop signs, the installation of traffic calming measures such as mini roundabouts or traffic circles, kind of all different kinds of names when you get to these small things, smaller versions of a roundabout. I think fully supportive of the green, but I would encourage staff to paint the green as big as possible, and to, in one of your photographs of a Chicago, of this system, there was a white painted line, black asphalt, and then the green paint. And it was really just nudging the cars further right. So whether they're heading southbound on Canes or northbound on Adams, it just pushes them a little further right, so that might mean that what we have painted is a 9'6" or a 9-foot travel lane. That is a perfectly reasonable thing to drive down, particularly since that lane, if a car door were to open kind of in let's say Canes on the southbound facing car, that car can cross that white line in an emergency, right? So I would encourage us to do that, because I look to Marin Avenue as an extreme example of where I appreciate staff's willingness to try different things. So when I first moved here, the bike lanes were just going in. I hate the bike lanes on Marin that are not painted green. I don't feel safer on them. Cars seem to be going faster. Even today, cars don't seem to understand they're not supposed to be there. You see a few decade later, we got green bike lanes at the lower end of Marin right before it turns into Buchanan. Those are great. I easily identified where you're supposed to be. But if you look between, and I'm looking at making sure I get this right, but in the newest section that's right in front of, it's in front of the library. You'll note that when you're in that bike lane, there's a clear marking where the door zone is, and there's a clear buffer between that's marked on the ground where a car shouldn't be. And it just pushes that car a little bit further away from you and makes it clear to the driver's mind that, hey, I should be pushed a little bit further to the left. And as a bicyclist, that makes all the difference. And that is 18 inches of paint that made a huge difference. So again, I would ask that as we look at the details, which frankly, probably for the submittal, doesn't have to be fully worked out, but as we get closer to actual implementation, that we look at ways of making that travel lane feel as small for the car, while in reality, they have a lot of space to work with, and we make it as comfortable of a green space lane as possible. I was going to talk about all the things that you talked about, Preston. I'm less worried about dooring when you're in the counterflow lane, particularly if we can make it as wide as possible. I think the issue of cars backing up, we will have no matter what configuration we have. I think there's just that problem. I would also say that if you are in that bike lane and a car door happens to open on the passenger side, in an emergency, you can cross over and get out of that car door, the door that's opening. The only issue is on those blocks where perhaps there's a car coming towards you and that door is opening, right? That is a major issue. And that's why I concur with your opinion that we need to think of something different on Canes between Marin and Solano, both for the reasons that you raised, but also because that is one of the highest trafficked roads. I'm not 100% sure that that is the right solution. I think in general, two-way traffic or something has to be figured out, but that is why I asked earlier of staff is like, how fixed are we on what we proposed? Because I think we need to be able to have some flexibility to adjust as we get moving on this. We win the grant, the ATP is going to be going, and suddenly other roads are going to be looked at that may inform us on maybe we want a speed table instead of a traffic signal, or maybe we want to put one diverter in where we need to. And so I'd like us to make sure we have that flexibility as we move forward. Because I don't want us to miss an opportunity to get free money. And that's what this is. And one of our big goals as a council in our strategic plan was find more revenue. And this is an easy way. And for that reason, I would like to make a motion to go forward with option 4 as amended by Councilmember Preston, and with my, not necessarily any change, but understanding that as we work through the details, we make that green lane as wide as possible. Was there a modification you had? I can't remember.
No, I just wanted a second.
Was that clear enough? Sorry, I just want to make sure you have all of that. The traffic stops, the trip.
It's recorded.
Okay.
I guess just to clarify, you're moving resolution 2024-33?
Yes, sorry.
Okay, sure.
Yes.
Yeah. I would maybe just say, as a motion part of it, with consideration of the input that's been provided tonight.
Sure.
Rather than trying to put it all in the resolution itself.
I'll make a motion to pass resolution 2024-33, incorporating the discussion points that we had.
Seconded.
Councilmember Hanson Romero?
Yes.
Councilmember Jordan?
Yes.
Councilmember Tiedemann?
Yes.
Vice Mayor Lopez?
Yep.
And Mayor Mickey?
Yes.
Motion carries.
Thank you, everyone, for providing comments on that item. I know that that has been a long-running discussion in many groups within our community. So we move on to item 10-2, supplemental business license special tax to fund tenant and community services. I am going to pause at that point and say that based on FPPC guidance, in our previous meeting, it appeared that I was able to participate in the discussion. However, with the newly attached attachments, out of an abundance of caution, I am going to recuse myself, is that the correct term? And we'll seek further guidance from FPPC on whether or not I can participate.
Before you leave, Mayor, I would move that we extend the meeting until 11 o'clock to cover remaining items.
Yes, I will second that.
Mayor Mickey?
Yes.
Councilmember Hanson Romero?
Yes.
Councilmember Jordan?
Yes.
Councilmember Tiedemann?
Yes.
And Vice Mayor Lopez?
Yep.
And it is extended to 11.
Thank you.
Cue the Vice Mayor.
No pressure.
Hey, you gotta handle business. I need to feel official.
Yeah, there you go, right on.
All right, folks.
All right, with that said, moving to item 10-2, supplemental business license special tax to fund tenant and community services.
Yes, so this is an item of Councilmember Tiedemann and myself, and he's going to start, and then I'll do some walkitude in the middle, and then he's going to end.
Great. So if we go to the next slide. So this is a special business license tax proposed by Councilmember Jordan and myself. As a reminder to everyone, we didn't get a chance to discuss this last time. We heard some comments on it. We wanted to have a presentation to clarify some things, and there is an addendum to the memo we submitted last time, so I encourage anyone interested to go and read that for additional notes and data. To start us off, I'll talk about, sort of why we're doing this, and then I'll toss it over to Councilmember Jordan to give some detail about how it will work. Essentially, the motivation here is that currently we are spending down our ARPA funds, the American Rescue Plan Act funds that the city gets from the federal government. This was COVID era funding to enable enhanced city services to deal with the effects of the pandemic. And will run out in 2026. So all those funds have to be spent by local governments by 2026, otherwise they're clawed back. Now, as I think many of us realize, the funding that we got from ARPA during the pandemic is really useful and allowed us to expand some of our programs. The need for some of those programs does not go away with the end of lockdown. So the effort here is to try and replace some of these programs for which we won't have any funding anymore from the federal government. The biggest one of those is emergency financial assistance for tenants, which is one of the most cost-effective ways to prevent homelessness. If you prevent people from slipping into homelessness the first time with targeted short-term financial relief, then you avoid a lot of the costs of then rehousing those people and the negative effects of them being homeless. So that is one program that we've been funding with ARPA funds and that we'd like to continue. It should be noted that one of our motivations here is also that tenant assistance has a direct benefit for the people who actually rent them their units, in that if we are giving emergency rental assistance to someone, that rental assistance is then paid to their landlord and allows them to keep receiving funds, allows the tenant to stay in their unit. Usually it's not for a long term and gives them a chance to get back on their own feet and then go back to paying their own rent, which also avoids the cost of not having a tenant for their rental provider and avoids any costs of eviction for non-payment of rent. So there's a big benefit there to both sides of that equation. The funding opportunity before us, like I mentioned, this is a chance to replace ARPA funding, and as such, it needs to be passed before 2026. 2026 is the day those funds will absolutely run out, but they can run out before that. If we spend them down, we will not have them anymore and we don't get new funds. The opportunity is also a chance to change the way we do things slightly to be a tax on gross rental revenue. Currently, we have a flat rate per residence. This would match the approach of most of our neighboring jurisdictions and would get us closer to their overall rate. As will be presented in one of the next slides, our rate is well below that of pretty much all of our neighboring jurisdictions. The approach we're presenting also scales with the size and means of those rental providers, so there is a difference in how it is levied based on how big of a provider and how many units they have, which is trying to get at some means testing here. And I will turn it over to Councilmember Jordan.
Thank you, Councilmember Tiedemann. If you could go to the next slide, please, Slade Kirk. Thank you. So we received some comments about is it fair for the entire city to vote on a tax that only taxes some businesses? We already have business license taxes. This tax is proposed to be voted on by the electorate. Taxes cannot be passed by the city council. We already have business license taxes. We already have a tax on rental businesses of $115 per apartment, per residence. So this is just following in that line. I mean, to my knowledge, most, if not all, cities in California have business license taxes in which the voters of the entire polity have passed those taxes on those businesses that operate in the community. If you can go to the next slide, please, City Clerk. Thank you. So from the American Community Survey, which is run by the U.S. Census Bureau, it does surveys of the cost of rent across the country. And this is not like other data sets that one might find online from various real estate sites, which look at the rent as listed for a new rental. This is rents as they are currently being paid. At the size of Albany, it's on a 5-year rolling basis because Albany is so small, so they have to aggregate 5 years worth of survey data. The most recent is data for 2018 to 2022, and the rent estimate was $2,272 per month, and so that imputes a current average tax rate of 0.4% that those businesses are paying. It's currently a bit lower than that, actually, because as we'll see on the next slide, you can go to the next slide, rents have been increasing over time, and again, this is a 5-year rolling average, so what we see here, and again, keep in mind that the years that are shown here are the end of that 5-year period, so this starts at 2015, but that's really the average from 2011 to 15. This is normalized to CPI, or Consumer Price Index, for the Central Bay Area. And so you can see up until 2020, in this extent of data, that rents were tracking pretty closely to CPI. And then from 2020 to 2022, average rents increased. The increase is even larger than what's shown here, because again, this is a rolling 5-year average. So when you go from 2020 to 2021, in order to get that kind of an increase on a 5-year average, you have to have an even larger increase in the 1-year time frame. So at the end of that time period, average rents have increased more than 12% relative to CPI over the last few years, meaning rents are 12% more than the general index of inflation. Go to the next slide, please, City Clerk. And so this is the same curve, but the census also publishes data on what is the rent in quartiles. So at the lowest quartile, which is the rent at the 25% of residents pay for their home, the rent went up almost 20% relative to CPI over those last 5 or 6 years. So it's gone up considerably more than CPI. Go to the next. So this is the tax rates in the nearby cities. And so all the cities but El Cerrito charge based on a percentage of gross revenue rather than on a per residence basis. And you can see that most of them charge more than 1%. And in particular, if you count the number of residences that are rented, which is again an estimate from the American Community Survey, about 94% of the rented residences in these nearby cities have a tax on gross revenue of more than 1%. And it's about 1% more on average than Albany's current rate of about 0.4%. And so this is yet more data. So this is a complicated slide, but it's getting at what kinds of rates Councilmember Tatum and I are proposing to contemplate to generate the revenue needed to keep specific programs going, which he will talk about on the next slide. So following the precedent of Berkeley and Richmond, the proposal is a higher rate on owners of more residences. So owners of more than 4 residences in the city, the proposed rate is 1.7%, which would be less than those 2 other cities in total, even including the 0.4%. And then for owners of residences with less than 5 residences in Albany that they are renting, the rate would be 0.6%. And with those 2 and the known number of taxable residences, that would generate about $700,000 a year. There are about 700 residences that are rented that apparently the city doesn't know about because they do not pay their business license taxes. This is based on the estimate, well, actually not the estimate. The U.S. Census in 2020 actually counts. So this is not an estimate. They count the number of residences that are rented and the number of residences that are owner-occupied. And their count has 700 more residences that are rented than are paying business license taxes to the city. So about 1/4 of rental providers are not complying with the law to pay a business license tax. If the city can discover those, where those are, and you assume that all of those are smaller owners of fewer residences, then the revenue would be about $800,000 per year. And so with that, what will we do with the money? I'll hand it back over to Councilmember Tiedemann to talk about a prioritized list of programs.
Thank you. So this lays out the list of programs with their priority. It's important that they are prioritized, given that for some of these programs, it is not 100% clear or sure how much of that money would be spent in a year. Sometimes we may need more rental assistance, sometimes we may have less in a given year. So it's important that we program out a lot of this and have that additional seventh of additional means tested subsidies to get at not having spare money of this left over, as this is a special tax. But to go over those briefly, the first is staffing, which is just to make sure that we have the ability to implement everything we actually lay out. The second is the rental assistance, financial stability that I mentioned earlier. That is mostly to keep people housed and would be to the benefit of both tenants and rental providers. Next would be code enforcement capitalization. That's a one-time cost because essentially code enforcement usually pays for itself, but you need startup costs to get it going and finance those first couple code enforcement items. Next would be those legal services for tenants and rental providers who need it. So means tested based on who can't afford it themselves. The next item would be rent review. This is something we already charge fees for, so it would be folding in this into this larger tax. Then the fifth and sixth are Albany Project Hope, which is our master leased homes for homeless residents, and Albany Cares, which provide a variety of services. I want to emphasize here, we have this column saying returning to renter providers. I want to emphasize that the first several of these, in fact, including that code enforcement, some of them, and down to that rent review program, some of them go back to the people paying this tax, the people renting residences, and the tenants who some of this may be passed on to. And even some of those that do not directly benefit or pay that money back to those people are about legislating or regulating the rental market. So they are to do with the people that they are taxing. So that code enforcement that is largely about rented residences, that rent review, again, that is a substitution of existing fees and goes back to the rental market. And even that staff time is, to regulate and enforce and implement some of our programs that have to do with this. So while not every dollar of this does go back to all the people paying it, the vast majority is intended to benefit or go towards the rental market in Albany, as well as has benefits for all of us. So that was the overall goal there.
Yeah, thank you. I should make clear on the slide that this code enforcement capitalization is specifically for code enforcement on residences that are rented. So residents that are owned would not, code enforcement on residences that are owned or occupied would not be paid for by this program.
Thank you. And with that, we're happy to take questions.
Thank you very much, Councilmember Jordan, Councilmember Tiedemann, for your overview. Any questions, Councilmember Hanson Romero?
My two biggest questions right off the top of my head is one, what is the actual need for how much of these funds are we actually utilizing right now? Like, how many people have taken advantage of these funds that are available? Do we have numbers on that?
So
what's our actual
staff
need?
may have updated numbers, but the emergency rent support financial assistance from ARPA, I believe it was as of April, which was not quite a year in, had dispersed $300,000.
Okay.
And so the slide we showed had $200,000 because there's a presumption that's going to decline coming out of COVID. But we really don't know. It could be more, it could be less, we don't know. And that's why that's the first priority use.
Yeah, Yeah, go ahead.
I'll just add that we don't necessarily know how it's going to go, but I will note that eviction data for the county is showing that it is increasing and has stayed at a high level after the moratorium ended. So we obviously saw evictions were down during the moratorium across the county, and in a lot of counties it was predicted, that will immediately go up afterwards as people evict people that, they weren't allowed to. In Alameda County and a couple others, that has then not gone down. It has gone up to higher than it was before the pandemic and then stayed there. So it does appear that there is need, and a huge amount of those are for non-payment of rent. So we have at least that to go off.
And my other question is, in knowing that we're putting together this housing commission, this seems like a perfect topic for them to be in discussion with. Why would we bring it up now rather than save this and let this be part of their work plan?
So if this were to go on the ballot in 2026, collection of the tax wouldn't start till 2027, and that would incur a potential gap in the program funding. And so staffing would have to wind down, end the program, and then restart it 6 months later, which incurs a lot of administrative costs, as well as potentially losing the thread with those tenants who might want to benefit from it. Because I know from the working for over a decade to try to get more households to apply for our tax rebates and tax exemptions, that it builds over time. And if you just cut it off and restart it, you're going to lose the thread with a lot of people.
And kind of my last question is just the overall fairness. It doesn't seem fair to me that it would just lay on the property providers as opposed to across the board. So
I think, like I mentioned in going over the slide of the uses, I think part of our thinking there is that a large proportion of this money is reinvested back in the rental market. So we are, there are benefits. I will not say that there are not benefits to our entire city to keeping people from falling into homelessness, but the thinking is that we are levying a special tax on the rental market to pay for a variety of services that largely benefit the individuals who are in that market. I would also note that, like Councilmember Jordan said at the start, it is not unknown for a city like us to put a tax on some portion of the population that is not necessarily universal. I also don't think that this is the only thing we should be exploring. There are plenty of other programs that I think we'll have to explore or think about or fund that we are going to do more general taxes for. And this is sort of one of the tools and one we, I think, should be considering. Councilmember Jordan.
Yeah, I'll just offer that we do have, as I mentioned, existing business license taxes. That revenue goes to the general fund. So, it's maybe a difference of political philosophy, but the fact is we already have money flowing from businesses to the general fund, which is, could be viewed in the same light as this proposal. So I would say if one is opposed to this proposal on that basis, then one should be opposed to all business license taxes for the entire city.
well, and actually that brings me, because we've had a presentation on business license taxes and how we are planning on moving forward with those business license taxes. And we've seen already that, different businesses operate with different, percentage of revenues. And so I feel like that also has to be folded into that business license tax usage as well, and fees as well. So I don't think we've come up with a perfect solution on that front as well. So that kind of really needs to really be enveloped with that in that mindset.
Yeah, and I think that's why the rates we're proposing are calibrated to what 90% of the tax rate on 90% of the rented residences in our neighboring cities is, so that we don't get out of whack with the market. So we're just replicating those market conditions.
And then just last and final question was, I noticed on your data graphs, a lot of the things, we started seeing the rental increase in 2020. Was that correct? And was that kind of in line with around the same time? I can't remember exactly when this was, but kind of wrapped around in the same time frame as when the state kind of implemented, their cap on how far you could increase rents?
Give me 1 second. My encyclopedic knowledge of California housing law is failing me, so I'll look up when 1482 was first passed.
You caught him out. Wow. Just for those who are listening, Councilmember Tiedemann does this in his day job as well. So,
1482, the law that instituted a floor of rent control, which for anyone who's not aware, that's 5% plus CPI and cannot exceed 10%. That was passed in 2019, so it was a little bit after that we started seeing those rise, especially.
So in fact, we did see what we had assumed we would see is when you're capped as a property provider, you're going to take advantage of increasing as much as you can with knowing that, unforeseen things could happen.
We did, though I think there's probably a lot of different explanations of exactly why that happened. I wouldn't necessarily tie it all to 1482, but I would need to look at it, unpack it all the more.
I just want to caution, reactions you don't expect, you think you're going to help, and then you end up with unintended consequences. So,
yeah, I appreciate the note.
yeah, I actually expected that to happen with the rent review program, but that was because in going door to door and talking to people, I can remember one conversation in particular where the resident said that their rent hadn't been raised in a number of years, and then it was raised 25% all at once. And they were okay with that because they realized they'd gotten, basically a kindness for all those years. And I was worried once the rent review program came in that would create this incentive to raise it 5% every year. So I was not a huge fan of the rent review program, but, I wasn't here at that time, or sitting up here anyway. But in terms of state law, state law is what state law is. So whether it caused it or not, the data is the data, and the rents are going up faster than CPI dramatically. And so the revenue is going up much faster than CPI dramatically.
Thank you, Councilmember Hanson Romero, for your questions. I only have a couple for you fine young folks.
Who are you calling young?
I got the gavel. I'll save the spicy stuff for discussion, but maybe I'll jump into the spice now. I know last meeting we had quite the heavy hand of public comments around this topic, and so I'm curious. Since then, have either of you interacted or engaged with any of the rental property owners here in Albany, and if so, to what extent?
I've been responding to email, but that's been the extent of my engagement, yeah.
Okay, appreciate that. And then I think this kind of piggybacks off what Councilmember Hanson Romero was alluding to. But
I'm sorry, I could put a little more to that. So for instance, one of the rental providers, they understood that we as a council could pass this tax, and so I clarified no, it would go to the voters, and they were like, okay, if the voters pass it, I'm okay with that. So there were various sort of technical clarifications. Obviously, there's the main issue, but there was the ability to provide, some information like that.
Appreciate that. This is probably going to be a question more so geared for you, Councilmember Tiedemann, and your expert opinion and experience. What type of, do you foresee any type of consequences with with having a special business tax license on rental providers?
It's kind of hard to predict. I'd say that to some extent, we've attempted to calibrate this to minimize that impact. I think the biggest part of that is having that tax be lower on people who are smaller property owners, who are renting fewer than 5 units, where the increase in the annual tax for them is going to be, I would say, pretty manageable. It's going to translate to about $45 a year, which is about a little under $4 a month. So I don't think that that would merit a huge increase in taxes or in the rental rates charged there. And I would also say that, like presented earlier, our neighboring cities have much higher rates on this, on gross revenue of rented residences. And I don't think they've seen huge dire impacts as a result of that. So I think we can take that as a model of, the market can handle it to some extent. But again, I think the biggest thing is that we are minimizing that impact for the roughly half of the units in Albany that are rented by small property owners.
I'm just going to offer a numeric corrective. So at 0.6% with the those residences being over, or the average being over $2,000 a month, it would be more like $150 a year per residence rather than 45.
I was saying the increase over our 115 per unit.
Well, the 115 will stay. So we're not changing the 115. So this is entirely new.
Right.
So it'll be about 150 in addition to the 115. The 115 is a general, goes to the general fund. That's a separate thing, and we're not proposing to touch that.
Thank you for correcting my math.
Thank you. Yeah, thank you for that clarification. I just have one more final question for the both of you. I know Councilmember Hanson Romero also alluded to this, so I just want to dig a bit deeper. Do either of you have a sense of the number of property owners that have rental units? To what extent some of them are just your ordinary mom and pop rental providers, or folks who maybe are in operation with something much larger? Because I think this starts to touch on this issue of equity, who get taxed and by how much. Because clearly someone who may have 5 units, regardless of the situation, probably has much more flexibility than someone who's maybe just renting out a portion of their house that they also happen to live in.
Yes, so that's the data we use to bifurcate it from large and small owners is based on our business license tax data. So that's, that's reliable data on how many units each person owns. So the assumption there is that, yes, if you have more than 5 rental units, then you can afford a higher tax rate than someone who has a smaller number, who might just be that mom top who either are renting, the other part of their duplex or a single house that they've invested in, or something like that. And I'll also mention that from that data, there is there are a moderate amount of people who are sort of in the middle there, and there are a small amount who own a very large number of units. I think our biggest provider is over 100 units. So, that means that a fair bit of that big property owner slice is from people who own quite a large number.
Yeah, I'll offer that half of the residences from the business license tax data are owned by owners who own fewer than 5 each. That said, ideally, the tax would be structured based on total number of residences owned by each owner, but we only have access to the data regarding Albany. So owners that own fewer than 5 residences in Albany may own more residences outside of Albany. So that number of a bit over 1,000 of the residences that are rented in Albany that are known, because they pay their business license tax. That's kind of a maximum of the number of small rental providers. It's probably something less than that, but we have no idea how much less than that it is.
Thank you for noting it. I remembered to put it in the memo and I forgot to say it.
Thank you both. Councilmember Hanson Romero, any further questions? All right, we move on to the fun, exciting part of public comments. How many do we have online and how many do we have here in person?
Getting more speaker cards. So I have 2, 4, 6 in the chambers, and then 3 online attendee, 4 that raises hand.
8 or 5.
In the interest of time, let's limit each public comment to 2 minutes. We'll go ahead and proceed with those.
We may need to extend also.
We had just
make a
over 10
motion?
total. Yeah, we do need it.
Should we make a motion to extend to 11:15? Is that enough time, you think? 11:20?
2 times 2, 4, 6, 10.
That's just over 20, yeah.
Yeah, so I mean.
You can do it later.
So 11, are we 11:15? 11:30? All right. Why not?
Motion to extend to 11:30?
Seconded.
Councilmember Tiedemann,
Yes.
Vice Mayor Lopez,
Yep.
Councilmember Hanson Romero,
Yes.
Councilmember Jordan,
Yes.
and Mayor Mickey's recused. So the motion carries to 11:30.
Right.
Okay, if you can line up 3 at a time, Catherine, Peggy, and David.
Hi, my name is Catherine Krolikowski. I'm a voter and a taxpayer here in the city of Albany. I've lived here since 2014, and my wife and I are, I guess, mom and mom landlords, not mom and pop. So I have concern about adding this tax. It looks like it's targeted to landlords and tenants, which we've talked about already. Landlords and tenants already pay an extraordinary amount of property tax here in the city of Albany. And so, for city services. And, increasing the cost of rental units is going to discourage more rental units being built and being offered in the city. So we have a 2-unit property right now. So I live in one and we rent the other one. And, our garage got destroyed by a tree a year ago, and we're considering replacing it with an ADU. Yay, you'll get tax money, you'll get check off on the statewide thing, which you were written up for in the paper on Sundays. Albany was called out as not having new building permits. But why would we want to add to our costs as landlords? And so we are seriously considering not building the ADU because of additional taxes and these kinds of things. So of course I'm against homelessness. I want to keep people out of homelessness. And this seems like a great program, but we had a lot of data of finding exactly the right amount of money to continue this program. It's the ARPA funding, right? But we didn't see very much data about the effectiveness of the current program. And so I think that would be super important to see whether the money expended so far has actually kept people out of homelessness in the city of Albany. I have another question. My time's about out, but I'm curious about whether the University Village actually pays taxes and whether these benefits would go to tenants who are not actually paying taxes or would end up paying the business license. Thanks.
Thank you for your comment.
Good evening, council and staff. I'm Peggy McQuaid, and I think it's good that you're thinking about this now far in advance of when the money runs out, but I think you need to give it a little bit more thought. Have you considered the impact of the funding that hopefully we will be getting through the BAFA bonds? And will there be a sunset on this tax? Because if the BAFA money starts coming in, perhaps the tax needs to be readjusted. Recently, we saw closure of restaurants and layoffs of fast food workers, allegedly due to the increase in wages in the fast food industry. And I hope you really give it some thought as to what the unintended consequences of this could be. And I was assuming that you had spoken with the property owners group that we have in town, but I'm hearing that you didn't, and I think that's a real mistake. And I think there's a lot of people in our community that from time to time could benefit from a little support. Thinking about the homeowner who, due to an unforeseen circumstance, maybe they lose their job or they become ill and they're at risk of losing their home and if they miss a mortgage payment. So perhaps they need to be included in the ability to get funds. And I do have concern about the tax on the ballot at the same time as the BAFA bond. If voters are looking at two taxes, similar in what they do, they're going to vote for the one that they don't have to pay. And we really want that BAFA bond to pass. So we need to be careful about that. And I think of Albany as a community that supports and cares for each other, each of us recognizing our responsibility and our collective role in ensuring that everyone thrives. This proposal taxes a small segment of our community, and I'd prefer a broader and more equitable tax with everyone sharing and uplifting our friends and neighbors. Thank you.
Thank you for your comment.
After David would be Peter, Derek, and Ronaldo.
Not sure how it works, so you call names?
Yeah.
Okay.
I think I already called David. Yes, go ahead.
Good evening, council members. I'm David Hertzer. I have been a housing provider in Albany for 50 years. That's a long time. I believe the proposed ballot measure is premature. I think the proposal requires more study and analysis and thought and should be sent to the Housing Advisory Committee for review. Alternative funding should be considered, such as a parcel tax, a city income tax, the general fund. The proposed tax targets approximately 844 individuals in Albany. The population of Albany is over 19,000. Thus, 4% of the population pays the tax, and 96% pays no part of the tax. This is not just and it's not fair. The proposed tax is for community services described in the Albany housing element. The housing element represents the goals of the city and the state. Community services should be paid for by the entire community, not by 4% of the community. I did have a question for the city attorney. If the proposed tax is placed on the ballot in November, is there a 2/3 vote or a majority vote needed for passage? Can you address that later? Thank you.
Thank you for your comment.
Peter?
I'm Peter Campbell. I've been a resident of Albany for 52 years, so I have a stake in this community. I have several reasons for urging you not to act on this proposal this evening. It's been argued that these programs are considered to be community value proposals. I don't disagree with that. I'm in favor of the programs. I think they're good programs that you have proposed here. But I do have problems with the numbers you've thrown out. I have problems with the fact that ARPA funds weren't in existence prior to the pandemic. Suddenly we have to have them continued. Maybe they should be, but I think it requires more discussion, as has just been said. And I also believe that this really needs to go before the Housing Advisory Commission before it's considered here. The council set up the Housing Advisory Commission to discuss matters about housing. And then that commission is supposed to advise you on what to do. And that's being ignored in this proposal. So I urge you to have this go before the Housing Advisory Commission before considering it further in this body. I'm also concerned that this proposal, or this tax measure, if it goes on the ballot, would be paid for by 844 or fewer voters in Albany, or residents of Albany, providers in Albany. There are, according to the numbers that were put out in the letter that you presented, there are 844 entities that would be paying this tax. And with nearly 20 million people, 20,000 people in Albany, it's just not fair that those few people should pay for the benefits that accrue to everybody. It's easy to pass a tax for people. It's easy for people to vote for a tax that they don't have to pay. And that's what's happening here. Almost everybody in Albany would be voting on this measure. It's easy to vote for something that they're not going to have to make any payments on. They'll just stick it to the guys those few little people that have all the money in the world because they have these properties which may or may not be encumbered. They may or may not be making a profit on them, but they're going to have to pay a tax that I don't have to pay, so I'll vote for it. I don't think that's right. So I urge you not to do anything on this evening. Take it to the Housing Advisory Commission and then consider it at a later date. Thank you.
Thank you for your comment.
Derek? After Derek is Ronaldo and Margie.
Good evening, City Council members. I'm Derek Barnes. I represent East Bay Rental Housing Association. We've been around since 1939. We know a little bit about housing, representing about 1,500 owners who own and operate about 60,000 units of housing. Got a lot of notes here, so I'll try to get to them very quickly. We urge you not to advance the ballot measure, proposed special business license tax on rental property owners. Questions: who is responsible for the greater public good in keeping people housed? We don't expect this targeted subsidy and insurance from other industries. What is the problem that we're trying to solve? Are you trying to replace ARPA with the Emergency Rental Assistance Program for rental households? The pandemic is over. Are we engaging rent code enforcement? More of that? We just need more education as an investment area. And then legal counsel for renters and owners to resolve issues. I think that's too expensive for a city like Albany. The area city tax rate comparisons don't consider the services each city provides. So that was missing in the analysis, and doesn't consider the other operating costs that have skyrocketed. My members are complaining about insurances being canceled, increased exponentially, utilities, services, and other materials. And quite frankly, Richmond and Oakland don't have the best track record for housing currently. Impact to renters if this advances: 1, more smaller owners are getting out of this business. 2, less below market rate housing, because the small owner operators provide the lowest cost housing in the area, and that means higher rents long term. We would like you to focus on an analysis of research to better understand the problems, incentives for keeping legacy owners in the business of housing, incentives for developers to produce more housing to meet your RENA goals, and rethink the city programs to consider the following. Just a few more seconds. Education and compliance, for sure. Emergency rental assistance and households in need. We believe that there's a need for that. Alternative dispute resolution methods, like a mediation first program, which we're working on with the county now, as well as representation services with the city of Oakland. We think that's a better use of funds and really kind of divert some of the higher cost of dispute resolution. So remember, less rental units on the market means less rental revenue collected, equal less taxable revenue for vital city services. Thank you.
Thank you for your comment.
Ronaldo Marin is my name, and I want to preface this all by saying that I've spent 30 years of my life trying to pay this building off in Albany. Finally accomplished that. Looking at this as my retirement, and I'm mad as hell. Mad as hell. Because every time I turn around, I feel like there's a government bureaucracy sticking their hand in my pocket for nothing that they earned at all. This thing you're talking about was a gift from the federal government to begin with. And it's like a kid who got their bike, is getting their bike taken away from them, and they don't like it. And you want that bike back. But you want to pay for it on the backs of the housing providers. How the hell am I going to do that? Regardless of the amount of money. You say it's only this percent, that percent. But it still keeps taking and nicking away at my money. Just recently, I've had a 28%, you all probably got this in the mail, 28% increase with waste management. My utilities are up 22%. I've got a second story retrofit I'm looking at for 15 G's. Okay? Insurance got canceled. Had to go to a third party at triple of what I've been paying. How the hell am I going to pay that? I can't raise my rents over a certain amount, and I keep my rents low to begin with. This is getting to be impossible to stay in business. I've done everything I can to be a great landlord for a lot of years. You guys can wait a minute or two. I'm not a resident of Albany, but I invested in Albany because of the great city that I thought it was. The infrastructure, the schools, and I put a lot of money taking care of this building and remodeling it over all these years. And I can't even vote on this thing. Seems unfair to me. One last thing. Under the social equity, it would provide legal counseling for tenants and renters, rental providers regarding evictions who otherwise would be unable to afford such. Who decides that? What does that mean? Who decides who can afford it? Are there any qualifications? Is there an income benchmark? How does that happen? Who does get the benefit of this? So that's all I got to say. Thanks.
Thank you for your comment.
Hi, my name is Margie Marks. First, I want to really know what the city's going to do about the 25% of landlords who are not following the law. That's a lot. They're breaking the law. What are you going to do about it? The second thing I want to say is that when these landlords are talking about restrictions, more restrictions, you know, they don't want to be a landlord because there's too many restrictions. The city of Berkeley has more restrictions than any city I know of, and there are rental units being built all over that city. So they have stricter restrictions than we have and more, and it hasn't stopped people from being landlords in Berkeley. The landlords always remind us, being a landlord, it's not a hobby, you know, it's your business or it's your retirement. Well, businesses have practices, businesses have licenses, businesses have requirements to stay in business, and this is just part of that. Has the money helped the homeless? I could say for a fact, yes, it has. I'm part of the group that runs the free shower program at the high school. There were so many of our clients from that shower program were housed in a house that Albany rented that had 4 bedrooms, and from that, those people got moved into permanent residences, and they're still in those residences today. That's the overwhelming majority of those clients. The people that didn't get housed had mental health problems, and you know there was nothing the city could do about it. The other thing is, what I don't understand is the franchise tax board allows them to write the expenses off on their taxes. So when they talk about the expense of being a landlord, a lot of those expenses, including the cost of the building, can be written off every year until you reach a certain amount. So there is a tax advantage for them. Thank you.
Thank you for your comment.
Hi, my name is Matthew Thomas. I've lived in Albany for 35 years, and I spent all of my professional life working for a local governmental agency related to taxation. I do urge you to read the public comments that were submitted via email. I think they're quite eloquent, and they're well thought out. Comments, this tax, by only taxing housing providers, I think is inherently unfair and arbitrary. Not all rental providers are wealthy. Many rely on this for their retirement. And like a tariff, in the end, the added cost will be passed to the tenants. Cash flow wise, on a gross basis, I think you've underestimated or understated the cost to the smaller landlords. The single family property landlords, the costs are much greater. With property taxes, if you have a mortgage, everything is just that much more expensive. I'm gonna go a little bit over my time, but it won't be much. My questions and concerns. I think this is an intrusion into personal financial data. Some questions. So what's the process to report this gross income? Is it by a tax return, a fillable form? What's the confidentiality of this income information? Can it be? Can anybody get it via a public records request? And are there any protections to protect that data from being used for other purposes? I got a question about the code enforcement component. I quote, a code enforcement program needs to occur with an inspection program. Well, I wasn't aware that Albany had an issue with uninhabitable units. And if we don't, is that just in effect creating a problem that doesn't exist to justify the tax? The memo states that the bulk of funds are going back to rental providers, to be kind. That just seems really counterintuitive. And also with this, rental housing providers are going to be the only funders of Albany Cares and Project Hope. So if you're scrambling to replace funding, and in this process you're bundling items or specific programs, are the items tied forever to this tax? Will there be protections regarding unbundling or rebundling, meaning adding items? What happens if or when the tax revenue does not cover the program cost? Or what if there's a surplus? I think in the end, look, we're a community.
Please wrap up your comment. Thank you.
I'll wrap the last few sentences. If the community decided that services are important, then the community votes on a tax to support our mutual beliefs, and the community as a whole should participate in funding those ideals. A select few should not have to subsidize public or social policy. And, we don't solely tax seniors to pay for the senior center. We don't solely tax families with children for our schools.
Thank you for your comment.
Kieran Shenoy, Government Affairs Director with the Bridge Association of Realtors. This proposal is premature. From the materials presented, you really don't know what the true cost of the rent relief program will be. The memo provided by Council members Jordan and Tiedemann seemed to equate current ARPA spending on the rent relief program to future needs without taking into consideration that future spending may not need to be as robust due to the people finding their way back to stable work in the post-pandemic world. The program may have been necessary during and perhaps for a couple of years after the eviction moratorium ended. However, no case has been made for continuing the program at its current level. Thus far, no data has been presented as to the number of evictions in Albany annually since the moratorium ended, nor has data been presented as to how many of those evictions were due to non-payment of rent, or how many total rent relief grants have been awarded over the past year. County data is simply not representative here. Large cities like Oakland likely push these numbers higher than actual numbers in Albany. The current max rent relief grant in Albany is $21,000. Is that amount of rent relief justified given we are well beyond the pandemic? Though a rent relief program could be a very good thing, you simply don't have enough data to ascertain how much money is really needed and what a fair tax levy should be. Secondly, no consideration, as many people have said here, no consideration has been made by this proposal of the drastically increasing cost of property insurance, labor and other maintenance costs, as well as the cost of new square footage-based parcel taxes. Keeping yet another tax on rental housing will ensure death by 1,000 cuts for many of those small housing providers, and will simply push rental housing providers to either sell their units to owner occupants, further constraining rental housing stock in the city of Albany, or force owners to raise rents and burden tenants further. ARPA funds should last into 2026, as has been noted. The city has time to fully discuss this proposal, which should be preferred over presenting the voters of Albany with a half-baked measure that does not properly address the real needs of all Albany residents.
Thank you for your comment.
Hello, this is Chris Moore, East Bay Rental Housing Association. I agree with that Karen Chenoy just had to say is there's really hasn't been enough research done on this. We saw a lot of work on the tax rates between the different cities, considerable amount of work, but no comparison about the services that Albany would provide versus the services that would be provided at those rates in other cities. It's a key aspect that needs to be researched. East Bay Rental Housing Association was not reached out to, not contacted by the authors. That is not the case with just about every city in the East Bay now. In fact, they provide services for the city of Oakland. They just been selected to provide services for the county. So they and also the Albany Property Owners Association certainly should be discussed with and walked through. Better research. The county evictions numbers that were thrown out, we can't do an apples to apples comparison when you compare Alameda County, which continued their eviction moratorium up until 12 months ago, and also the city of Oakland and Berkeley considered it, continued it. They've only been out of it 9 to 10 months. Contra Costa County took 13 months before their eviction started to drop off. We're not even there, and that should be, those numbers shouldn't even be discussed without proper research and doing apples to apples comparison. And you need to also throw out there that the city of Oakland only funded 30% of AMI renters or less compared to 80% AMI in other counties across the state. It's a disaster over there. What you should do is focus on production. That will drive lower rents and provide better service to the community. Expedite permits for rental housing, a moratorium on permits, fees, and run this by the Housing Advisory Commission and IBRA and others. Thank you.
Thank you for your comment.
Hello, this is Elaine Stelton. I'm sick and a little hoarse tonight, so please forgive my voice. I would very much welcome an opportunity to speak with you, and I hope that you will give us at Albany Property Rights an opportunity to discuss this with you further and not do anything in haste. I also would welcome EBRA, some of the speakers that you've heard tonight from East Bay Rental Housing. They are very well versed in the local housing market and economy, and I think they should be brought to the table. I think also your Housing Advisory Committee was a great idea because it really brought the community into the picture. And I don't really think two people should be driving this. This seems very unfair. No matter what their good intentions might be, this really should be a community effort driven by the community. And much more should have been discussed before we ever got to this stage. With regard to evictions, I want you to know I tried very hard to break out the number of evictions in Albany to separate that number from all of Alameda County, and it's not possible to do it. So I personally believe there are almost zero evictions in Albany, but unfortunately I cannot prove that to you. But likewise, you can't prove to me that there are any evictions in Albany because we just can't break that data apart, unfortunately. I wish we could. With regard to,
Thank you for your comment. That's it. Thank you, everyone, for your public comments. We'll bring it back here to the dais for a discussion. We did hear several questions. several common themes of question. I guess a couple of them we could direct to city attorney and city manager really quickly, just for point of clarification. Question, does UC Village pay taxes?
It's an interesting question. It depends on what type of taxes we're talking about, if it's a sales tax or if it's certainly not any parcel taxes or special taxes.
Thank you. And then question was directed at the city attorney. For a ballot measure like this, would it require 2/3 or a majority in order to pass?
This is a special tax, so it would require 2/3 of the electorate to pass.
Thank you for the clarification. There was also several questions about BASA funds. Perhaps this is more your base here over here, Councilmember Tiedemann, but what would be the impact, or how could they be used if we've seen that come down the pipeline if this bond would pass?
Sure. So BAFA, the Bay Area Housing Finance Agency, is planning an up to $20 billion bond on this ballot. I have updates about that if we have time later. But those funds are predominantly going to be used for production and preservation. There is a clause of the enabling legislation that is trying to have 5% of those funds be used for protection, but given the current state of California's constitution, it is in fact not legal to use bond funds for protection measures. You have to use them for what we call sticks and bricks, for putting things in the ground or buying physical buildings. So I think there is a nexus here in that we are trying to deal with some protections which cannot currently be financed by the BAFA bond if it does pass.
I know, everyone wants to hear my lovely voice tonight. And then there were a couple questions that I think are a bit interconnected, questions around this thought of this idea of income data, and is it protected? One, is that even applicable to the situation? And then also a question to concerns of research or lack thereof.
Yeah, in terms of data protection, I mean, given that, as I've said, 90% or 94% of the rented residences in the nearby cities are subject to a tax on gross revenue, I presume those other cities have solved that. I've asked staff to look into that should the council decide to go forward with this. So that the action tonight would be to direct staff to develop a ballot measure, and that would be part of developing the measure, of looking at the ordinances of these other cities. Yeah, so I think you asked the second question. I don't know. I can't recall it. I'm sorry.
Were you asking to repeat the second question?
Oh yeah, right. Second question. I guess that was on research. So the data we got for the program costs, was from staff for the existing program costs. And again, as I referred to earlier, the city had spent or dispersed $300,000 of ARPA funds in less than a year for emergency rental support, and those are available on our disbursement logs that we approve each meeting, so you can see the individuals who received those funds and the amounts that they received. And so we took a conservative estimate by going about 2/3 of that.
Appreciate that. Thank you for responding to questions. Open for discussion. Whoever would ever be so brave to go first and just rip the Band-Aid off here.
I was just going to say, we're already at 11:15. We had moved to 11:30, correct? I don't feel like we have adequate enough information for this. I do also believe that this is something that needs to be taken up by the Housing Commission. with more data and more information. I do not want to direct staff to prepare this as a ballot measure at this time. I would move that, make a motion to move this topic to further discussion at a later time, or off to the Housing Commission once it's been fully established.
Do we have a second? Do not have a second at the moment. Discussion continue. Councilmember Tiedemann or Councilmember Jordan have any rebuttal towards that? I will if not, I will gladly give my thoughts on the matter.
I've a couple thoughts there. I think the Housing Advisory Committee will serve a good purpose, but I don't think it should, I don't think it is our generalized practice or should be to delay things to get it if I think we can make the decision well enough at the council level, especially given that, you know, all decisions eventually do come back to us. And if we can figure out the policy and if we believe in it, then I don't see a reason why we shouldn't take votes on it when it comes to us and when members of the council bring it. You know, I think they're going to have plenty of other work without this of giving feedback on some of the other programs in the housing element, of which there are many. And I think also, given the timing around this, as Councilmember Jordan covered, is based on this needs to be, if we want there to not be a gap in services and we want this to take effect so that it can pick up where the existing funding leaves off, then it needs to go on this ballot this year. And I would prefer it go on this ballot.
Thank you, Councilmember Tiedemann. Do you have anything additional to add there, Councilmember Jordan?
No.
Well, thank you. My thoughts and perspective and how I'm thinking this through is that, one, I definitely applaud both of you for trying to put something forth that's creative in terms of solution building. I don't want to say it's premature or short-sighted. I think the fact that you're looking for an action now speak to the necessity of trying to make sure we have something in place for both rental property owners and tenants alike. Though I still, personally, I have my hesitancies about what's in front of us at this moment. That said, I can't be fully convinced at this moment that this is something I could put my name behind if it were to go on the ballot. But that's partly because I would love more input from more folks to come at the table. And one of the other bigger things on my mind is we are still without a permanent finance director, and I think this would be a conversation I would love to have a permanent finance director involved with to help guide us in any visions that we have for our community. But I know that at this point in time, that's just not feasible. And that may take quite some time, and I don't want that to be what determines whether or not we put something like this forward. I wouldn't say I'm torn or confused or anything like that, but I am in this very perplexed space that, again, yes, we do need something to substitute dried out ARPA funding that are anticipated to dry out. That I think we can all recognize and understand and agree with. And I think one of the public comments made a very sound question. What is the goal or intent of this? Is it to replace ARPA program, or is it to really look at ways to protect tenants and property rentals owners alike? I I don't think we're able to answer that question fully or in its entirety until we bring more folks to have these conversations. I'm gonna pivot here instead of saying that we look to direct staff to do something right now. I would instead encourage or consider a motion to form an ad hoc committee. I know that's a bit time consuming. I know you two want to get this moving. But I think even just an extra several weeks, doesn't have to be several, even just an extra couple weeks of just talking with folks and really hearing out people's concerns, because I understand that, and I understand folks want to be able to know that they've been heard and that their concerns are validated. I'm open to something like that. I am curious if either of you might be open to that. I am not opposed if it's both of you on the ad hoc committee, but I do think this warrants having a bit more conversation, discussion to bring back to the table, just so we have a bit more input.
I'll never say no to sitting on an ad hoc. In this case, it's something we could do. I'm not sure if it will garner us that much more. I think some of the disagreement here comes down to a sort of moral impasse about, how should we be paying for these sorts of things and what is the role of people who provide rental housing in that. And there may be some fundamental disagreements there that, no amount of meetings will get to. If that's the will of the council, I could go with it. I would prefer we move forward, and I would ask city staff, I think you know the question that's coming, of what is our timeline of when we would need to take action to get this on the 2024 ballot?
It's getting pretty tight, to be honest, with the gravity of the ordinance that would need to be written with the help of the city attorney's office and the number of other ballot items, as well as the formulaic models that need to be run through our technical consultants, which, I have encouraged them to potentially fast track if they are so engaged, but it will still take some time and to synthesize through the council. A relative example, very different topic, is your sidewalk parcel tax update, which took several months.
I would thank you for that. I would also say that, like with any of the actions we take that are like this, that are directing staff to prepare the ballot measure, this is not the last time we get to look at this. We're not definitively putting it on the ballot. We get a chance to fine tune or take a look at that language in the future. And then we get time to consider it with the voters. I think that's something that's sometimes lost here. If our decision is not the final one, it will go to the voters, and like I mentioned earlier, it's a special tax. It will require a 2/3 majority. So, there will be a lot more conversations about this, even if it does get put on the ballot, in terms of the leading up to that actual vote. So I would prefer we move forward with it.
I'm really concerned, though, with the fact of you saying that some of the comments that we've heard here tonight is we would be putting out a ballot measure out there to be voted on by the majority of people who would not be paying for it. And that's where I have an issue with this. You're asking people who have no part in this to all of a sudden approve this money that other people are going to be paying for. And I don't think that that's just. I don't think that that's fair. I don't think that that's right. I think that this item needs to be pushed off to another time. It's late. We're almost at 11:30. And I would like to move that we, I guess, revisit this next council meeting so that we can have more conversation, get some additional information. I think there's too much at stake here.
Get worried about pushing it again to another council meeting just because we know the extent of which we have folks actively engaged in this, that we'll have another repeat of this. I think we're all tired. I think if we could come to a resolution this evening, all the better.
Vice Mayor, I'll make a motion if you would entertain. I would move that we direct staff to prepare a ballot measure as detailed in the item.
Do we have a second?
I will second.
Do we have opportunity for discussion before we vote? Please do not interrupt. Please do not interrupt. Thank you. I entirely hear you out where in which you say that we can agree to move this forward and not be married to it. There's still an opportunity that if we vote for this, to direct staff to curate something, that it may not even likely get past us voting through it in a future meeting.
Could
Go ahead.
we ask City Manager, could you advise on this, please?
I will simply state the facts that there's a significant amount of time involved in preparing this to the degree that is the accountable, responsible work performed by the two of us primarily, as well as the retaining of the consulting team, which is estimated at least $25,000. And that's not to say that in the past we haven't invested in that service and the council has declined a tax. That did occur with the business license tax, but what I will submit is the time commitment primarily. If we are requested to do this, what are we not doing? And that's always a moving target.
I'm also, based upon the numbers and the data that you have pulled together, I too am more focused and more concerned on finding out more about the property providers that aren't paying their business license, that aren't, because what was that percentage that you had given?
25%.
And that's a huge chunk of change right there. I would be more focused on looking to those property providers that are not following the law, that are not paying their fair share, and be more focused on moving towards that direction. And code enforcement, I think that we're lacking in the code enforcement in that. And I would encourage us to focus more on that than this.
So if those were brought into fold and they paid the existing $115 a year business license tax, that would be $80,000 a year. So it's a different order of magnitude that we're talking about. Obviously, they were brought into the fold and this tax passed, then that would be the difference between $700,000 and $800,000. I wonder if an addendum of simultaneously having an ad hoc committee to continue conversation on which yourself, Vice Mayor, and Councilmember Tiedemann would serve would be helpful. So that the two are running in parallel and so that we can make adjustments based on those conversations.
So you're amending the motion to also include?
Well, I can't amend it because I didn't. Well, yeah, I can't. Yeah, well, I'm suggesting it to the motion maker.
To also include an ad hoc committee.
Actually, while you guys are thinking about that, can we make a motion to extend to 11:45?
Seconded.
Councilmember Jordan?
Yes.
Councilmember Tiedemann?
Yes.
Vice Mayor Lopez?
Yep.
Mayor Mickey? I'm sorry, has to be recused.
Yes.
Councilmember Hanson Romero?
Yes.
Motion carries to 11:45.
So with something in that in mind, I think I'm far more agreeable to something like that working, because again, I believe in the sake of having equitable space in these conversations. And to Council Member Hanson Romero's point about folks who are kind of flying under the radar in our community, I think that's a whole nother issue, tangential, yes, but it's something that definitely needs to be within our radar, because could very well be the numbers are higher. We don't know. But I think at this moment in time, I would have expectation that the ad hoc committee, we're going to move forward with this idea that the ad hoc committee does do due diligence to speak with appropriate stakeholders. So I'm agreeable if there's an amended motion.
I will amend my motion to direct staff to prepare the ballot measure as proposed under this item with the addendum that a ad hoc of myself and the vice mayor will work with them and take further input from stakeholders. Seconder, agree with that?
Yes, I'll second that.
Please.
Just to clarify, the ad hoc committee is going to work with stakeholders on the potential ballot measure?
And staff.
Okay, so then Councilmember Jordan will not be involved any longer in these discussions. You will be?
Correct.
Okay.
Thank you for clarifying.
I'd ask that we call the question.
Do we have a second, or do
Councilmember Jordan seconded.
the clerk?
Councilmember Hanson Romero,
No.
Councilmember Jordan,
Yes.
Councilmember Tiedemann,
Yes.
Vice Mayor Lopez.
You boys. Yes.
Mayor Mickey is recused, and the motion carries.
Thank you all for the discussion. Vice Mayor and I will do some more work. Hopefully, Vice Mayor is still here.
You mean mayor?
Mayor, excuse me. I got so used to referring to our meeting head as the Vice Mayor.
And I'm hoping the mayor will decide that we want to end early. or I mean,
He came close.
Thank you for having me back. I heard someone might be making a motion to end the meeting early.
yes, I would like to make a motion to,
Well, I would like to ask a question of staff, since the next item also regards a potential ballot measure. And so at the same time, issue may obtain that I'm not sure it can be pushed off readily.
I wouldn't advise it. We've got quite a plethora of work items at this point, and your charter amendments are intended to come back on June 3rd for efficiency purposes, which I appreciate. So I would encourage the council, since you're already here, if you may, consider this, and that way we'll have our marching orders.
I think we can knock this one out in 10 minutes or less.
oh, yeah.
So moving on to item 11-1, authority to appoint officers and directors and organizing the city. This is Councilmember Jordan's recommendation.
Thank you, Mayor. So to be brief, as given in the memo, city managers, city administrators for most of the cities, the vast majority of cities in Alameda County, have higher authority for director and officer positions. Our charter has the council with that authority, both for reasons of efficiency. Looking back over time, 8 years, this council has not changed or changed who the city manager recommends to hire into those positions. It's pretty much been agreement. So there is an evidence of strong utility there for the council's involvement in that under the council manager form of government. The manager is responsible for implementation of policy, which includes generally overseeing hiring and firing staff. And so given the precedent of other cities and that form of government and the lack of council actually making tangible changes in past hires, my recommendation was to remit that authority to the city manager. I would also say it might provide some efficiency in terms of being competitive in hiring into those positions. We did have a case, and I do not know if this was a contributory cause, but we did have a case where on the day that the council was going to take action to approve making an offer, a candidate withdrew. Now, if the city manager had that authority to make that offer at a more opportune time, maybe we wouldn't have lost that. And whether that's the case in that situation or not, you can certainly envision that it would be the case in the future. As far as city organization, as I presented in the memo, looking back, while by the charter the council has the authority to organize the city, meaning structure the number of departments, the jurisdiction of the departments. In fact, over time, it seems like the council has not necessarily been doing that, and I don't think it has caused any harm that I'm aware of, that some of that has changed through time without overt council action, to my knowledge. And again, under the council manager form of government, the organization of the departments is really a function of implementing the policy that the council sets. And therefore, I would recommend remitting that authority to the city manager as well. And to say this also has a nexus with forbid that day should come when Albany needs to find a new city manager. If we do not offer those authorities, and many other cities do, that is going to put us at a competitive disadvantage at that time.
Looking for questions from council.
I have no questions.
Not seeing any questions from council, I'll open it up for a public comment. No public comment in the room. Any public comment online?
None.
Okay, I'll open it up for council discussion.
I make a motion to approve.
Seconded.
I was prepared for a drag out battle. Okay.
Sorry.
Saw.
I misplaced paper.
I'm not complaining.
Councilmember Tiedemann,
Yes.
Vice Mayor Lopez,
Yep.
Mayor Mickey,
Yes.
Councilmember Hanson Romero,
Yes.
Councilmember Jordan.
Yes.
Motion carries.
With that, I would ask if we could skip over item 12. If anyone has any.
I make a motion to adjourn tonight's meeting.
Looking for a second?
Second.
Vice Mayor Lopez,
Absolutely, yes.
Mayor Mickey,
Yes.
Councilmember Hanson Romero,
Yes.
Councilmember Jordan,
Yes.
Councilmember Tiedemann,
Yes.
and we're adjourned.
Thank you all for who took part in today's meeting. If you or a loved one is experiencing thoughts of suicide, mental health, or substance use crisis of any kind, of emotional distress, call or text 988 to speak to a trained crisis specialist. Thank you all.
Thank you, Mayor.